I just received confirmation that we are all set to go, so I'm ready to start when you are.
All right, thank you, Carrie. I'm going to get started then. Grab my notes. Good afternoon, everyone. My name is Anissa Asaibi-George, and I'm chair of the Boston City Council's Committee on Education. Sorry, I just lost my notes. Where'd they go? Sorry about that. Excuse me, guys, for a sec. There they are. In accordance with Governor Baker's March 12, 2020 executive order modifying certain requirements of the open meeting law and relieving public bodies of certain requirements, the City Council will be conducting this hearing virtually. This enables the City Council to carry out its responsibilities while adhering to public health recommendations and ensuring public access to its deliberations through adequate alternative means. Today's hearing is on docket number 0276, order for a hearing regarding the implementation of policy requiring all Boston Public Schools to have a full-time mental health or social emotional health support specialist. Docket number 0277, order for a hearing regarding the current state of inclusion classrooms in BPS. Order number 0758, order for a hearing regarding dyslexia services in the Boston Public Schools. And docket number 0980, order for a hearing regarding autism services in the Boston Public Schools. This public hearing is being recorded and live streamed on boston.gov/city-council-TV. It will also be rebroadcast at a later date on Comcast 8, RCN 82, and Verizon 1964. We will take public testimony at the end of this hearing. If you wish to testify via video conference, please email juan.lopez@boston.gov to sign up. When you are called, please state your name and affiliation or residence and limit your comments to no more than 2 minutes to ensure that all comments can be heard. You may also submit written testimony by emailing ccc.education@boston.gov. This afternoon, I am joined by Councillor Ed Flynn. I will briefly introduce our first two panelists and then give colleagues an opportunity to offer opening remarks.
I also just wanted to say, sorry to interrupt your flow, Councillor Asaibi-George, but you've also been joined by Councillor Mejia.
Thank you. I've just returned to the Zoom screen after reading my script, and I've been joined by Councillor Mejia and Councillor Janey. Councillor Ed Flynn, would you like to, I'm sorry, I would also want to introduce very quickly, Edith Bazil is with us and Roxy Harvey, who will give some opening remarks following colleague open remarks. Councillor Flynn.
Thank you, Councillor Asaibi-George, for having this important hearing today. These dockets are within this hearing. The dockets that are within this hearing are all how we can better work together, support our students, especially our students with disabilities. I also want to thank Councillor Asaibi-George for having me as a co-sponsor for the docket on dyslexic services for our students. I've talked to many parents who have children with special needs challenges and learning related challenges, and how difficult it can be for them to get the appropriate services for their children. So it's important that we have this conversation about how we can better help all of our students, especially those with disabilities. I know this hearing will also talk about services for students with autism, the state of our inclusion classrooms, and having mental health and social and emotional support for our students as well. With the pandemic still going on, it's important that we ensure that our special education students get the resources that they need. I look forward to hearing more about this topic from our panelists and colleagues. Thank you, Councillor Asaibi-George.
Thank you, Councillor Flynn. I'm not sure who came in next as I was reading my notes, Councillor Mejia or Council President Janey. I wasn't sure. I'm not sure who was here first. I was reading my notes. Councillor Mejia, you have the floor.
Thank you, Councillor Asaibi-George. Really excited to be here today, and thank you for hosting the series of hearing orders. As for those who know, Edith, it's great to see you in the Zoom, because you know I've been out in these streets advocating hard around these issues in terms of equity in our Boston public schools, specifically for students who have been continuously disregarded and disrespected and devalued, and issues around special education. Autism Sprinter is an organization that you and I, Edith, know very well. Dyslexia is also another issue that is impacting a lot of students of color in particular, because oftentimes those situations go undetected. So really happy to be here and centering this conversation around equity and the importance of uplifting the struggle that a lot of Black and Brown parents in particular face as they navigate this system. So looking forward to the conversation and here for it all. Thank you.
Thank you, Councilor Mejia. Council President Janey, do you have any opening remarks?
Yes, please. Thank you. I just wanted to thank you, Councilor Asabi George, for your leadership in this space. Thank my colleagues for joining, for their advocacy. Very important topics. Very grateful for the advocates. I've had the pleasure of working with some of you. Just from my own experience working in education, know how important these issues are, whether we're talking about autism, whether we're talking about supports in our schools with nurses and social workers. Was glad to, in my first term, join that strong advocacy in making sure that we have full-time nurses in our schools. So again, thank you for your leadership, and grateful for everyone who is partnering on these issues. I am looking forward to getting deeper into the numbers around race and zip codes, because we know that students of color, students who are learning English, students who live in poor communities of color are the ones who suffer more when it comes to the opportunity gaps in our schools. So I hope that we are going to be digging deep to understand the impact for those students who are often much more vulnerable. Thank you, Madam Chair.
Thank you very much, Councilor. Prior to the pandemic, we knew our schools needed more resources to provide high quality mental health supports and special education. The pandemic has only shown an even brighter light on these needs. Mental health support and special education support are not extraneous to education. When our students are in crisis, learning cannot happen. When our students are depressed and struggling with their trauma or in need of emotional support, they are not able to fully participate in their classes. Without support, their coping mechanisms may interfere with their ability to lead a full life. We also know that as a district, we struggle with the school to prison pipeline. Behaviors seen as dangerous are oftentimes symptomatic of trauma and/or unmet special education needs. Our educators need better training to identify these behaviors, get to the root causes and change the circumstances so that our students are not deemed problems. Our students need to have multiple avenues of support. In BPS, too many Black and Brown students, boys in particular, are shunted off into sub-separate classrooms or are not seen in their full humanity, which often leads to being punished and criminalized. Providing high quality mental health supports and special education are racial equity issues too. McKinley schools are the perfect example. They have the highest concentration of Black and Brown special education and high needs students. Many of these students would have been better served with early intervention and screening and appropriate support along the way. Yet the McKinley students are not at the center of our conversation so far. It is important that we keep in mind that special education and social emotional learning are not contents in the way that reading and writing are. Special education and social emotional learning have to be present always. For every special education student, they need unique interventions, modifications, or accommodations throughout the day. Every student's mental health, along with their emotional literacy and ability to navigate social interactions in healthy ways, impacts every moment of their day. We need to build in the infrastructure at BPS so that every student can access the support they need. I advocated strongly for a school in every nurse building. We would not be able to handle this pandemic without them. We know that our special education students are struggling right now. We need to ensure that they have access to the appropriate specialists, that our students are being screened early on, and that as we identify what they need, that we provide them those supports fully. I can't just be with students. It can't just be students with families that can afford a lawyer. We know that all of our students are stressed by this pandemic and that many of them are having a hard time with their mental health. We must ensure that they can access psychologists and social emotional support specialists as soon as possible. The impacts of this pandemic are going to be with us long after a vaccine is available. We have to be ready for our students' needs. I hope that this hearing will provide more information to the public on what we are doing to support the well-being of all students. I want to know, how do we compare nationally with regard to the ratio of support specialists to students? How much will it cost us to have a full-time psychologist or social emotional support specialist? And how long will the hiring process take? What would it take for us to provide special education learning centers at every school building and time built into student school schedules so that they can access learning centers? What are we doing for our dyslexic and autistic students now during remote learning? How much will it cost us to have a general education teacher, a special education teacher, and a paraprofessional in every inclusion classroom? How are we providing training to our educators on appropriately handling dyslexia, autism, special education, social emotional learning, and mental health? I hope to ask more questions and get many more answers in today's hearing and in future conversations with all of you. As Roxy Harvey likes to say, behavior shows us something. Our students, when they act out, are showing us that they aren't supported in the way that they need. The same is true for us as adults. How we respond to the mental health and special education needs of our students shows us exactly how we do or do not prioritize those needs. I am hopeful that this hearing will lead to more behavior that shows our students that their well-being matters and that their education matters. With that, I will turn this over to our first two guests for opening statements. Ms. Roxy Harvey.
Thank you very much, Councilor Asabi George. I appreciate the opportunity to be here and to speak for our families, because a lot of these topics, they go back to our central problem right now of services not being given appropriately. You know, even when we had the opportunity to have some in-person services, and students should have started to get the services they need and the professionals they need. We had issues of students who have ABA hours right in their IEP clearly defined. They have autism, they have different disabilities because ABA can be given for other students beyond just the disability autism. And frequently it would be the concern that was raised by both the parents and the teachers that some of these students weren't getting the services they needed. There was no one providing these ABA hours. So we say a child needs a behavior plan. We know they need ABA hours to be successful, along with other accommodation modifications and IEP services. But as a district or as a community, we didn't provide it. And then we wonder why these children are continuing to display those challenging behaviors, or they're continuing to suffer and not make progress. And I think we need to stop that mentality of basically saying the child's not motivated. Oh, something must be going on at home, and all these other things that are said about these children, instead of looking at what we're offering, and that some of our children are not getting the services they are entitled to. And that goes back to even these in-person services, because the simple fact at the end of the day is there are some children in this district who cannot receive a free, appropriate public education and are not receiving FAPE because they cannot access remote learning. So as long as we don't have a specific plan to ensure that our high needs students, as defined already, our district coming up with a plan that is kind of redefining high needs students into the ones that have one-to-one paras, is offensive. We're not going to start this divisive pattern of trying to separate and say, oh, this one, everyone's high needs, but the highest of the highs. We can't do that. We can't continue to try to create these divides of the haves and the have-nots. We have to work together and to service those students that we know cannot access remote learning, because they are part of our community. They are in need, they are in crisis, their families are in crisis. You know, we have families that literally, not figuratively, their children are harming themselves. They are harming their families. And you're right, they are communicating something. They're communicating, I'm in crisis, I need help. And that child can't tell you the help they need because they don't know. We're their adults. And we must be the ones to come up with a specific plan to provide these services to our students. You know, and I always go back to, you know, it's hurtful when we go around and we see in the city of Boston right here, that if you can afford a private school, a parochial school, or a pod, you can get some of those in-person services. But some of our most vulnerable students and families that can't afford that, they're getting nothing, because if you can't, and a plan that says, well, if you have a one-to-one para, those 150 or 130 students will offer you a building and a space with your para and a Chromebook. That's remote learning in a different environment. That's remote learning still. So if they couldn't access it, that didn't change the access. So I think we have to be very mindful of the direction we're heading for this sped to prison pipeline, because we are setting these children up for failure. And we must ensure that they are getting the services they need with mental health, ABA, all the different services. It's individualized for a very specific reason. Our children need different things, and there's some that we can provide these services remotely, but to be clear, there are some that it cannot be done. They must receive in-person services to get the help that they need to be able to function, survive, thrive, and to keep a family safe. And these are very important things. I think our families are currently left in limbo. And, that's why we must come up with a plan. It's been over 8 months now. I mean, we have to come up with a plan for these high needs students who can't access the remote, so that they can get those services. Because some of them are your children with autism, your children with dyslexia who are in the 8th grade reading on a 1st grade level. You can only imagine how that makes these children feel. They're in a room with other kids who are reading on that same 8th grade level. Everything's presented to them on that way, but they can only decode up to a 1st grade level. And they kept moving on to the grade, and no one got them the services they needed. I mean, as someone who has a child that is many years behind in their reading level, and I asked for help from K0 when he came in on an IEP, and still didn't get the full help that he needed till several years later. And the interventions that could have been started earlier, if they had been started earlier. My child that has autism, ADHD, and dyslexia could have been doing much better than where he is now, instead of being labeled unmotivated and targeted for a separate program. So, and I'm glad, I thank you so much for mentioning the McKinley schools, because frequently they are the neglected population. That is considered like the dumping ground for the Black and brown students who displayed outward behavioral issues, instead of getting the immediate help they needed placed there. Because when I hear about the day schools, Horace Mann, Carter, I frequently see McKinley missing. And I do ask the question, where is the McKinley school leadership, and what are those services that those students are getting? Where are they? I also asked about the Horace Mann School for the Deaf and Hard of Hearing, because as we know, their building, they need swing space. Those students don't have a building that they can. There's some of our highest needs students right there, and they're supposed to have a plan for swing space and a plan for permanent space. Yet they are also left without a plan. So another group, once again, of our high needs students that do not have plans. So I really hope that today and moving forward, that we can come up with concrete, specific plans that are shared in native language with all of our families, so that they can know what their children can do and what is being offered by the district to allow their children to thrive. Because that's what's needed at this point. Not a task force to plan a plan of a plan. It's time for the real plan right now. So I thank you all for your time and for highlighting our students with these high needs and with autism, dyslexia, social emotional learning issues, and all our special needs students who in various ways are suffering, and we need to really individualize what they need. Thank you.
Thank you, Roxy. And I didn't share with colleagues and with the panels that are upcoming that Roxy and Edith will be offering testimony at this time. We will then move to the Boston Public Schools panel for a brief presentation, questions by colleagues, and then we'll move to the panel after that. I should have said that at the opening. I apologize that I didn't. I muted myself before I said it. Edith, welcome.
Thank you so much. Thank you and good afternoon, Honorable Councilor Asabi George and Honorable City Councilors. Thank you for having this hearing. I appreciate this opportunity. I just want to start out by saying I echo everything that Chair of the SPED PAC, Roxy Harvey, has said. And I really thank you for this opportunity. So we've all heard the phrase, special education is not a privilege, it is a right. But these are not just words. The phrase was termed as a result of the many stories and experiences of children with disabilities whose gifts, talents, and potential will not be realized without specialized instruction, supports, services, and accommodations that allow them to access general curriculum and the life of the school and make effective progress. The goals also are equity, inclusion, post-secondary options, movement towards independent living, and economic self-sufficiency. The faces, stories, narratives, and struggles of children with disabilities and families give meaning to these words. So with that, I want you to meet Lily. Lily, say hello.
Hi.
Say hello to everyone that can see you. So when you see Lily, you may conclude that she is beautiful and a friendly child, and you would be right. Lily is smart. She's an 8-year-old who is good in math, a talented artist, classically trained in ballet, loves to pick out her own outfits, and has incredible style. Lily also has autism. When schools closed, it was very tough for her. Lily could not transition to her BPS school due to the pandemic, and she is not a child who could benefit from remote learning. She has meltdowns when her schedule changes. When schools closed, Lily asked if she was sick, if we were having lots of holidays, and she started doing pretend school at home. Then she started stimming, a behavior common to some children with autism. Her meltdowns increased, and she began engaging in self-injurious behaviors. Her appetite was thrown off because her eating routine at school changed. And then one day we realized that she had been pulling out her eyelashes over a period of time when we noticed that all of her eyelashes were all gone above her left eye. Now, DESE states that even when schools go fully remote, districts should make, quote, every effort, end of quote, to provide in-person learning either in school, in community, or in home. As a family, we were lucky to enlist a third party using autism insurance and high-priced private insurance to get in-person home services for Lily. Many parents do not have this option. My point is, there are a lot of Lilies in BPS. There are high-need students who require in-person learning with various physical, sensory, psychological, intellectual, neurological, and other disabilities who without services may not recoup lost learning and skills. We know that access to quality special education services in BPS has been a barrier to Black and Brown students prior to the pandemic, and is even more so during the pandemic. Now the district is creating a bifurcated definition of high needs, dividing families by using superlatives for determining high needs. High needs is not higher needs. It's not highest needs. High needs is high needs, and BPS must identify and offer in-person learning for all students who are high needs and allow parents to opt in or opt out. In closing, BPS had months, 8 months in particular, to plan for in-person learning in safe spaces, coupled with suggestions, recommendations, and plans provided by school nurses, the BTU, the SPED PAC, and other organizations and advocates. We've also had many conversations with BPS, and we've asked BPS to learn from private schools in Boston, as well as other districts in Massachusetts, the country, and around the world that are successfully doing in-person learning services. Failing to plan for in-person learning in safe spaces is failing our students. BPS has not made, quote, every effort, end of quote, to provide in-person learning for high-need students. Our high-need students can't wait for BPS to get its act together. BPS can and must do better by putting students and families with high needs first and at the center of planning. Thank you so much for the opportunity. I'd like to also echo that we cannot leave out our students at the McKinley schools. We have 4 McKinley buildings that are populated by Black and Brown, primarily Black and Latinx males. And to say that we are going to serve the Carter and Horace Mann, but ignore that the McKinleys are private public schools as well with high need students is disgraceful. And so it is my hope that BPS will begin to address the needs of our students who require services in order to maintain their daily living skills and other critical skills as well. Thank you so much for this time.
Thank you very much, Edith, and thank you to Roxy. The two of you, I think, have shared from sort of like enhanced testimony around the impacts that both the school closures and not full supports have in regular times, not even just in COVID times, it has on our children. So I thank you for being here and sort of setting the tone and some of the tempo of what we would like to cover today. I'm going to move the two of you back to attendee, and we're going to bring in our panel that includes Boston Public Schools representation. I also want to acknowledge that we've been joined by District 6 Counselor Matt O'Malley. Thank you, Matt, for joining us. So while we bring in the Boston Public Schools folks, they're coming in slowly. I'm going to send you back over to attendee. Thank you both. So just in the sake of time, while members of the Boston Public Schools central office team are joining us, I will have them start to introduce themselves. I see everyone, but I don't see Ethan here. Is Ethan joining us?
Yes, Counselor, he should be
Excellent.
in the waiting room or in the participant space.
I don't see him. Is he coming through yet? There's too many screens, too many cubes and boxes. He might be under special education. I bet you that's him.
Yes, that's him.
Very good. All right, so I think that we've got most. I think a few will keep in panelists and promote them if we need them to answer questions or offer more information. I'm not sure, Ms. Zayas, who will be starting us off from the panel.
I'm going to get us started if that's
Great.
okay. Great.
Great.
Thank
And
you.
Superintendent, Deputy Superintendent.
Chief Academic Officer.
Chief Academic Officer. Welcome, Ms. Zayas.
Thank you so
Please
much.
introduce yourself for the record. Thank you.
Thank you, Madam Chair, members of the committee, counselors, and all who are joining us this afternoon for this important conversation about the Boston Public Schools support of our students' mental health and social emotional learning, and specific programs for our students with special needs. Before framing our dialogue this evening, allow me to very briefly introduce myself, given that I'm just meeting many of you for the first time in my role as Chief Academic Officer. I'm originally from New York City, where I served as a teacher, founder of an inclusive dual language school, and a district leader prior to serving as a regional turnaround superintendent in the New Jersey Department of Education, and as a consultant to districts, principals, and youth development organizations nationally prior to arriving in Boston nearly 2 years ago to contribute to the bold, stated goal of culturally and linguistically responsive pedagogy and inclusive programming. My work over the last 20-ish years has been really specifically targeted at closing opportunity gaps and developing systems where seemingly intractable inequities can be addressed and alleviated. And since it is College Month here at BPS, I'll share that I'm a Rutgers and Harvard alum, and now proudly representing Xavier, which is my doctoral work, HBCU. While the entire city of Boston community works together to contain the spread of the coronavirus, and we seek new ways of engaging our students, BPS remains deeply committed to meeting the needs of the whole child for every student in every classroom. This commitment is rooted in an understanding that students' physical, mental health, emotional well-being, and positive development are directly linked to academic success. COVID-19 has disproportionately impacted Black and Latinx communities in Boston and nationwide. In this unique moment in history when our communities are faced with the realities of the twin pandemics of COVID and racism, more evident now made bare by the pandemic impact, Prioritizing the social, emotional, and physical wellness of students, families, and staff is a must for addressing equity and ensuring health and safety. Additionally, we prioritize the experiences and needs of historically marginalized students and their families to ensure that equitable student outcomes are centered in our planning. Ensuring students first have access to physiological and safety needs will lead to opportunities to feeling connected and loved by their teachers and classmates. And focusing on individual and collective well-being builds trust. Our school teams reinforce existing protective factors that students come to school with, those community and family-based assets. They build new coping skills and expand equitable learning strategies. BPS schools are using strategies to build school communities that are safe, healthy, welcoming, joyful, anti-racist, and culturally and linguistically affirming. This is the work of every educator and all support staff in every school, every office, and every space that Boston Public Schools students inhabit. This is exemplified by our whole school, whole community, whole child approach to learning and well-being currently outlined in our opportunity gaps policy, our wellness policy, and emphasized in our strategic plan. Every member of the BPS community plays a role in supporting the health and wellness of our students, and we must work closely with families and community partners to reinforce, model, and support the development of health literacy and healthy behaviors. I'll now introduce the team that will be sharing their office's work with you tonight. The Division of Academics, which I lead, houses 2 of the 3 offices that are called to provide information tonight: the Office of Special Education and the Office of Health and Wellness, respectively led by Assistant Superintendents Ethan Dablamont-Burns and Jill Carter, Assistant Superintendent Jill Carter. Separately housed in the Division of Accountability, the Department of Behavioral Health is supervised by Assistant Superintendent Ilich Nayeli Tabora and led by Andrea Amador, who will provide remarks today. Thank you again for the opportunity to share. I'll now turn it over to Assistant Superintendent of Health and Wellness, Jill Carter, to share about our social emotional learning work.
Thank you, Andrea, and good afternoon, Councilor Asabi George and other City Council members. My name is Jill Carter. I'm the Assistant Superintendent for the Office of Health and Wellness. Health and Wellness, as Andrea has shared, is in the academic division. The Health and Wellness Office oversees the district work on the whole child, as is outlined in our wellness policy. The office also includes social emotional learning, health education, physical education and physical activity, and wellness council supports. I'm focusing my comments today on the district's efforts to strengthen social emotional learning through a whole child approach, where SEL is a lever for equity and should be part of teaching practices in all of our classrooms. Decades of research have illuminated that social and emotional development is central to learning, and it's critical to the physical and mental health and well-being of our students. At BPS, we believe that strengthening adult and youth social emotional skills and competencies enhances our abilities to connect and relate to others across race, class, culture, language, gender identity, sexual orientation, and learning needs. Social emotional learning is the process through which individuals learn essential life skills and competencies that promote a positive identity, a well-managed self, healthy relationships, and access to successfully navigate their future. Our SEL competencies were updated in 2019 to reflect a transformative SEL approach, an equity-based approach to deepen the social, emotional, and cultural competencies of adults and students that is aligned with CLSP, or culturally and linguistically sustaining practices. Transformative SEL is a process whereby young people and adults build strong, respectful, and lasting relationships that facilitate co-learning to critically examine root causes of inequity and to develop collaborative solutions that lead to personal, community, and society well-being. This is situated firmly in a frame of identity, agency, and belonging. Boston Public Schools is leading the national landscape with SEL competency and skills being inclusive of equity and, more specifically, culturally and linguistically responsive practices. Over the past several years, BPS has been engaged in refining our district vision and strategy for SEL. Through partnerships with CASEL and the Rennie Policy Center, we have assessed the current landscape for Tier 1 cell programming and created a steering committee to clarify our priorities to move this work forward. Based on our own and national research finding, we are threading transformative Tier 1 cell practices throughout the day and the building. This includes incorporating teaching practices that build community and student and adult relationships, focusing on adult cell for all staff, but especially teachers and paraprofessionals, and deepening existing cell programming and curriculum, including through health education and physical education, integrating cell into academics, including arts. Through research grant opportunities, we are learning more about the implementation of cell in service of equity. Early findings suggest that our cell coaching model is having an impact, increasing ratings of climate, cell instruction, cell integration, and student collaboration in the research schools. By providing adults with the opportunity to learn about competencies in partnership with their colleagues and students, they are better equipped to create a learning environment where social emotional competencies and skills are modeled and embedded into instructional practices. Last spring, about 100% of BPS school leaders completed the CDC School Health Profile Survey, a survey that's designed to assess school health policies, programs, and practices. Survey results indicate that nearly all school leaders strongly agreed that they are committed to supporting their students' social emotional learning and development. 33% of schools reported that all of their staff have been trained on BPS cell standards, with others reporting partial training. 71% reported implementing at least one cell curriculum partially. How does this compare to national data? I heard you ask. According to CASEL, a national principal survey on social emotional learning, 38% of schools have developed a plan for teaching cell, but have reached only partial implementation. We know that high quality professional learning and school support are critical for improving cell implementation. This summer, we prioritized training school staff on adult cell. Over 2,000 educators participated in Boston Strong Cell professional development sessions focused on adult cell and creating a welcoming online learning environment. All principals also received an overview during the August Leadership Institute. Developing educator social emotional skills lays the foundation for success with students. This allows them to focus on integrating cell competencies into their instruction and their interactions with students. Research indicates that teachers who possess social and emotional skills have more positive relationships with their students and peers and are better able to create academically supported classrooms and engage their students more deeply. The BPS 2019 Youth Risk Behavior Survey indicates a lack of school connectedness and perceived trusted adults. 42% of our high school students did not feel close to people at school. Notably, feelings of belonging and connectiveness were significantly lower among students of color. Among middle school students, 44% reported that there was not at least one adult in their school that they felt they could go to. This indicates we have a large amount of work to do in this area, despite all of our efforts. I'll just end by saying, to actualize our academic vision, that all educators have access to the knowledge, skills, and resources that they need to provide every BPS student with a high quality, culturally and linguistically sustaining and well-rounded education that prepares them to actively and responsibly read, write, reason, communicate, create, and compute effectively within a global society. Social emotional learning must be intentionally integrated into academics across content. Cell skills are essential in order to prepare students for career, college, and life readiness. Thank you for listening. And I'll turn it over to the Assistant Superintendent for Special Education. Ethan?
Good, terrific. Thank you so much for having me, and Madam Chair and City Councilors and fellow Bostonians who care about all the young people in our city. Thank you for the opportunity to come and speak with you about these really 4 overlapping issues today. These are incredibly important issues, and I'm thankful to you, Counselor Asabi George, for having this hearing and for the opportunity to speak. First, this is my first testimony before City Council. I've been a principal in the system for 11 years and just taking this position July 1st. So want to introduce myself and talk about why I took this job, and I think it's relevant to the topics at hand. For 11 years, I was the principal at the Manning Elementary School in Jamaica Plain. And we were able to deconstruct a substantially separate lab cluster and made the whole school fully inclusive. So we had a substantially separate setting, and we were able to restructure the school so that it was fully inclusive and supported by an inclusive culture. And it's really important to say that while we were able to do that with the incredible work of amazing teachers and really wonderful family engagement, that it also comes with excellent academics. So we moved from the below or at the 20th percentile of performance to the 64th percentile of performance. And so really exciting to do that work. It was incredibly fulfilling and amazing to see so many students get opportunities and see themselves as students, and to see themselves as thinkers. And they would come from schools where they had not been successful and had not seen themselves as students and as thinkers. And to see that transformation was incredibly, incredibly powerful. And it's an important piece that I don't think is talked about enough, and actually heard about it talked about today at School Leader Professional Development, that inclusion really is often about excellent instruction. And that excellent instruction can make all the difference in a child and in a student's life. And so that's what we want to move towards. I also want to speak to, at the Manning, the importance of addressing both culture in a school building and making sure all the adult mindsets are in the right place, and that you have families and kids all moving in the same direction. And that's incredibly important. But that culture also needs to be supported by a school structure that supports that. And so that's why it was so exciting to be able to move from the substantially separate setting and not have those structures anymore, and to make it fully inclusive. So it was a wonderful experience to be there. And although it's a very, very small school, I'm hopeful that we can bring some of the lessons from that experience to the school district. And in terms of goals for special education, initially, and we look forward to getting into strategic planning once we get through some part of this pandemic anyway, but it will certainly include addressing inclusion. It will address high quality programming for all students, no matter where they are, and making sure that there is an equity of opportunities for all our students across the city, and really making sure that excellence and equity is there for everyone. And with regard to the topics at hand, I just want to give some information by way of introduction to each topic. And so inclusion was the first docket, and it's really why I took the job, and spreading inclusive practices and inclusive environments throughout the district, and figuring out how to do that. It has been mentioned numerous times already today, the issue of disproportionality in the district, the issue of too many Black and brown boys in substantially separate settings, and the concentration of them in certain schools. And what does it take not only to transform a school, but to transform a district where we are able to address those issues. And the work is well underway. Just again, mentioning the professional development of school leaders today, I heard them doing their culturally and linguistically sustaining practices, and hearing the voices of the school leaders and how passionate they are about addressing this issue, I think is really, really important. In the Office of Special Education, we're doing professional development with our coordinators of special education, so our COS, and really looking at what getting that culture and structure right there as well. And it's been exciting to get to know that group of employees and to really work with them on what this can look like at a district level as well. I'm working specifically with Dr. Granson and Ms. Felicia Saunders to address disproportionality as well. So looking forward to being able to continue this work. And I just want to name that I don't think there's any question that we have an issue with too many special education students in substantially separate settings compared to other states and large districts. This issue of disproportionality and inclusion and how they relate to each other, it needs to be addressed, and I look forward to engaging in that work. With regard to dyslexia and students with dyslexia, I want to be just to be certain that we do have screeners in place. It's relatively new guidance from the state, and we're actually looking to DESE to clarify their guidance on what those screeners need to look like and what appropriate implementation looks like. But our reading, our interim literacy screeners do include a screener for dyslexia, and we think that's really, really important. I think it's also important to say that we have made a substantial investment in early literacy through foundations and also continuing with Wilson and Orton Gillingham. We've invested over $1.2 million over the past 5 years in working on some of those rules-based reading programs in early literacy, and we think that's really important. And then lastly, the last docket with regard to autism certainly has gotten a lot of attention and is incredibly important. I think many of you are aware that the district has made large investments over the past few years within the ABA programming, and specifically this year, 20 new ABA specialists and 2 more additional program directors. But I think what's really important to say here is that we also are not just looking at creating new programs or sort of having hired new people, but that we're really looking closely at the quality of the programming, that we do walkthroughs with school leaders and with program directors, and we're looking continuously to what it means to be a strong ABA program. There, we are collaborating with our related service providers through speech and OT to make sure that they're integrated. We're all integrated together and making sure that the student gets a great experience wherever they are with regard to ABA. So with that, I just want to say thank you again so much for the opportunity to speak with you and look forward to engaging more deeply in the work. And with that, I will turn it over to Andrea Amador, Director in Behavioral Health Services.
And while you do that, I want to note that we've been joined by Counselor Campbell as well. Andrea, sorry for the
No problem. Thank you, Ethan. Good afternoon, Counselor Savi George and City Council members. My name is Andrea Amador, and I'm the Senior Director of Behavioral Health Services for BPS. I have the pleasure of working with school psychologists, district social workers, and transformation social workers serving Boston students, families, and schools. The role of behavioral health services is to meet the behavioral health needs of all BPS students by providing direct services and supports to students, schools, and staff across a continuum of prevention, early intervention, and intensive services. Additionally, the creation and facilitation of community mental health partnerships are a key aspect of our work. The comprehensive role of behavioral health staff within schools is intentionally designed to support access to high quality, equitable behavioral health services for all students, including universal supports for all students, targeted supports for some students, and intensive supports for a few students. A little bit about our staffing. The school psychologists and district social workers in behavioral health speak 11 languages. We have 24 bilingual school psychologists, 4 bilingual district social workers, and 29 bilingual transformation social workers. In regards to one of the questions we received, 21 BPS schools have at least 1 full-time school psychologist. 30 BPS schools have at least one full-time transformation social worker. In a comprehensive role, both school psychologists and social workers engage in a combination of direct services like counseling and case management, as well as systems and capacity building. In addition, the behavioral health services team serves as the district crisis team. Many direct services are tied to special education delivery. Tier 2 supports that are not on special ed service deliveries can also be provided by BHS staff. Both school psychologists and social workers are critical leaders in schools implementing the comprehensive behavioral health model and initiative in 77 BPS schools. In addition to supporting all 125 BPS schools, school psychologists and social workers provide additional special education support to early childhood centers, out-of-district placements, and proportionate share students and families. I'd like to take a moment to give you an update on our transformation social workers. In February of 2020, Carmen Calderon O'Hara was hired as the Director of Social Work. In the summer through the fall, Carmen led a hiring team that included hiring 57 transformation social workers. 26 transformation schools now have at least a 1.0 transformation social worker. 6 transformation schools have less than a 1.0. 4 other BPS schools have at least a 1.0 transformation social worker. And I would like to share a little bit of information about the work the school psychologists and social workers did through the 1920 school year. They provided at Tier 1 and Tier 2 11,500 consultations to parents and teachers. They completed 3,500 evaluations, special education evaluations, provided over 100 PD sessions. They responded to 1,200 school-based crisis, and we as a district crisis team responded to 111 large-scale district crisis events. Additionally, the staff provided over 370 suicide risk assessments and over 60 threat assessments. So that was the work that they did during last school year. And over the summer, we had, for the first time ever, a summer behavioral health services team with the support of the superintendent. We had 17 staff members who over the summer were able to provide behavioral health services to over 1,400 students and families, including some of the services I've mentioned: crisis support, counseling, family needs calls, and check-ins. The team of behavioral health has continued to do these activities now as school has started in this new school year. In addition, we work closely with several community behavioral health partners to bring additional services to students and families. Community behavioral health partners have also continued to work to provide behavioral health services during closure and over the summer. We also work with university partners to bring additional resources to schools while simultaneously supporting our workforce development of the next generation of school psychologists and social workers. And as I end, I just wanted to share some information on the YRBS data regarding behavioral health. We know that COVID-19 has disproportionately impacted Black and Latinx communities in Boston and nationwide. In this unique moment in history when our communities are faced with the realities of COVID, racism, prioritizing the social and emotional health of students is essential. In the most recent youth risk behavior survey that Jill mentioned, just want to highlight a few more things. In 2019, 35% of Boston High School students and 27% of our middle school students experienced persistent sadness. Over the past 2 years, the proportion of high school students who have attempted or considered suicide increased significantly from 9% to 16% respectively. Middle school students, particularly those of color, reported even higher rates of suicidality. 11% of those middle school students were reported having ever tried to kill themselves. As Jill mentioned, a lack of connectedness is also indicated in our YRBS results. What's more important is sexual minority youth are particularly vulnerable to social, emotional, and mental health related issues. Students identifying as gay, lesbian, or bisexual were 2 to 14 times more likely to experience depression, suicidality, and self-harm than their heterosexual peers. The disparities were just as great or greater for students with same-sex or both same and opposite sex partners. With all of this data, we must continue to prioritize all of the marginalized students and their families to ensure equitable student outcomes are centered in our planning. I thank you for the opportunity to testify today.
Thank you very much, Andrea, for your testimony. I see that David Bloom has joined us, but is he offering formal testimony?
I think David is available for any questions.
For questions, okay. And I know that we also have members of your team to offer or to assist in offering response to questions. So as I welcome my colleagues to start with their questions for this panel, I will let them into the room in the meantime. So, and for today's hearing, I am going to use a timer. We'll do multiple rounds as necessary, but I'd like to start with Councillor Flynn. Councillor Flynn?
Yeah, thank you, Councillor Sabi George. I had a question for whoever it's appropriate for, but for students that would be screened for learning disabilities, what grade would that start at? What type of screening would it be? And is it a thorough screening? And if they are tested for having learning disabilities, what would the next step be in helping them get services that they need in the interaction with their parents as well?
So thank you so much for the question with regard to screenings. Appreciate that, Councillor Flynn. It's something we think is incredibly important, and appreciate your passion for the subject. I think I just want to start by saying again that screening is available through Child Find as well from K0 all the way through grade 22, so that if a parent has a concern that their child may have an issue and have a disability, that they are able to approach the Boston Public Schools and say, I'd like to have my student evaluated. And so that is something that we are mandated to do, and certainly are able and equipped to do. And so that is something that we are in the midst of doing. In terms of ongoing screens, we are collecting early literacy data as soon as kids enter our schools. We are trying to understand what is happening with them so that we can make sure they stay on track. Specifically with regard to dyslexia screenings, that there is as I said, our major assessment system through MAP, which is through NWEA. We implement a set of literacy screeners to see how students are doing in an ongoing way. As well, I think it's important to say that we've just made a large investment in something called the Digital Assessment Library. So our assessors are going to have more access to more screeners over the course of this year, and we're in the middle of doing training for employees in that library of assessments, but that's an exciting investment that we've made. I don't know if there's anyone else on the panel who has more to add to that.
The one follow-up I had is I often have parents would ask me that they want to get their screened for dyslexia, but this type of breakdown in the system, or there's a wait, or there's some type of issue that develops. So if there's miscommunication and the parent can't get their child, what is the best route for that parent? What is the best thing for that parent to do in terms of seeking that screening that they're having a difficulty getting?
Sure. So, I mean, I think it's just important to say that DESE, the Department of Elementary and Secondary Education, has, and federal guidelines as well that govern the timing around as soon as a parent says that they would like to be in evaluation. There are very strict timelines that we need to adhere to. And when a parent asks for those evaluations, they should be given the parent's policies and procedures and procedural rights and safeguards to make sure they know what their rights are. Of course, if there is ever a problem with those timelines, which does happen, I don't want to say it doesn't happen, and certainly is happening in the middle of this pandemic, and can speak to that if needed, what we're doing to address the assessment backlog. But certainly they can reach out to the special education office via email or phone. And to be, just to be blunt, if you are having trouble getting in touch, you can also go to the state to make sure. I think it's really important that the community is able to hold us accountable to the guidelines that we need to operate under so that students get what they need.
Yeah, thank you. I have no further questions. Thank you, Councilor Asabi George.
Thank you very much, Councilor Flynn. Councilor Mejia.
Can you hear me?
Yep.
Okay, great. Thank you. So I do have a few questions. I'm just curious in terms of, and this is in the special education department. I'm curious about the staffing in terms of just the cultural competency. I'm just curious about the leadership, and because I know one thing is the actual need of the students, but I also think that there's a layer of cultural competency in how we go about addressing some of these needs for students. So I'm just curious of what type of technical assistance or support that department is getting to help address the needs of families who are a little bit more diverse.
Yeah, I can certainly.
But if I need to go in a little bit harder, I will. But I think that my question really is around just the diversity of the leadership within the special education department, and how culturally competent is it?
Sure. That's something we take incredibly seriously, think is very, very important. And certainly in my first months on the job, and looking at and analyzing and trying to understand. And I think it is really important. I would certainly agree with you, Councilor Mejia. Diversity in our administration is going to be incredibly important so that we are able to represent our families appropriately. And also that we are, no matter who's there, that we're doing the right work. And so we have already started, as I said, working with our coordinators of special education around issues of cultural competency. And we look forward to continuing that work and working with Ms. Felicia Saunders to develop professional development. So we are addressing that in an ongoing basis. And of course, also we'll be addressing that through hiring over time, and as there are opportunities to make sure that our staff is as representative as possible of the city as a whole.
Okay, great. Ethan, I just have another question for you. Would you believe that the BTU tried to meet with you all to discuss a plan? And I'm just curious as to whether or not, what the reservations were, or why weren't some of the plans that were implemented to help support families who have students with the highest needs. I'm just curious about what that looked like.
I'm sorry, Councilor Mejia, I'm sorry, I heard you say that we did what with the BTU? That they...
So I'm just curious as to why the special education department opt not to meet with the BTU before hitting the 4% to get a plan done, right? Since I apparently, from what I understand, had been trying to advocate to meet with the district to discuss a plan. that I think Edith mentioned earlier, but there was just no real input from the BTU.
Okay, well, Councilor Mejia, I would certainly defer to others on the panel to discuss, negotiations, but there were ongoing negotiations between the BTU, and certainly our priority. We are pushing. I was, devastated, as I think the superintendent was, when the rates went up and we had to close. And it is incredibly frustrating to us that we are not able to have our students in person now. It was really exciting to be there at the Ellis School on the first day. We had kids back in the building since March 17th, and we're working really hard to make that happen again. And we would like to see it happen, and we want to partner with our union partners to make that happen. And so I totally agree. We are trying to figure that out, and happy to take it.
I appreciate that. I appreciate that. I think what's happening is that there's a lot of finger pointing happening here, and parents are just a little bit confused. There's a lot of dodging. We just can't seem to get a firm answer, and so parents are just a little bit frustrated with the process. But I do have another question for you. I'm just curious of what steps you're taking to improve inclusion during this school year. Like, what does that look like?
Yeah. So thank you for the question. Excuse me. I actually, and David Bloom might be able to speak specifically to this if he is available, but we are making some investments in inclusion. And I think specifically as we think about what the larger strategic plan is going to look like for inclusion, that we not waste any time, and even in the middle of the pandemic. And in fact, the pandemic may give us some opportunities for inclusion that we're exploring and want to figure out. But it is really about getting, before we go into budget meetings with different schools, what needs to happen in schools so that they can be restructured for more inclusion opportunities. So it's really, it is both the cultural work around mindset and around culturally and linguistically sustaining practices, and believing in inclusion and getting teams behind that all kids can meet to extremely high expectations and deserve excellent instruction and can thrive with excellent instruction. But it is also about actually restructuring schools so that there are more opportunities for students to be not just experience inclusive practices, but be in inclusive environments. So we're excited about that, and I'd look forward to talking to you more about it.
Great. And then I do have another question.
So we'll save that, Councilor Mejia, we'll save that for the next round. We've hit past 5 minutes. I don't know if David had additional answer to add to that around the cost. No, thank you very much. Next is Councilor O'Malley. Councilor O'Malley I don't see him anymore on my screen. Councilor Campbell, welcome. Councilor Campbell.
Thank you. Thank you. Can you hear me?
Yes, we got you.
Okay, awesome, because I'm outside. So thank you to the panelists, and thank you for your hard work. Just a few questions. The first is, how are IEP evaluations happening? Like, how are they being processed? How are they happening? The second question is, what's being done with respect to the delay to those evaluations? So, what will it take to get us on track so that parents and students who are requesting evaluations are getting them done in a timely manner? The third question is, for those students that are currently on IEPs, one, what percentage of our school population currently is on IEPs, and how are we providing or ensuring that the services of students with IEPs are being met? And then my last question is on the, I guess I'll stick with those for now because that might take me over the 5 minutes. Thank you.
Okay, and terrific. Thank you, Councilor Campbell. I want to be sure I got your questions around evaluations. How are they being done? What's being done to address them? And also what percentage now of students are on IEPs, and how are they being met? if I've got that correct. So let me address the evaluations to begin with. We know there's no question that we have a huge backlog of assessments that need to be done. I was in a number of meetings today to address that, and we have started to address it. So, and we've addressed it in a variety of ways. I would say, number one, we have, particularly with regard to early childhood, we've opened up the old Endicott building as an assessment center so that families are able to go there to get assessments done, so that because space is a challenge because of COVID. And so usually we are able to partner with our early intervention centers. But our staff is not allowed into the early intervention centers now. So we've had to open up the old Endicott building. And I just want to thank our partners in facilities for helping with that, and our early intervention team for really helping to make that happen. So that's number one. Number two, we are working, I'm excited to say that even though school buildings are closed for students for instruction, which is awful, and I've expressed, how sad that is, really, and devastating for many families. We are able to have them open from the Boston Public Health Commission. We are able to have them open for assessments. So in-person assessments are able to happen in school buildings because it's about the density of people in the school buildings. And so those are ongoing and are continuing. We're not at this point able to compel staff to be able to do those assessments. So we are addressing that, but many teachers are showing their dedication to our students and kids by making sure that we get those things done. So they're working really hard. We have also opened up space where space has become an issue at Boston Latin Academy to be able to get related services and related service assessments and psychological service assessments done because sometimes space is an issue there. So the last thing I would say in terms of how we're addressing it is, I mentioned the investment we made in the digital assessment library that we have access to and that we are having our staff trained in, that will give our staff a lot of flexibility in how we are able to get those assessments done, and it does make it a lot more efficient for our staff to do that as well. So we are pleased with, we think we are going to be able to do it. One last piece on the assessments, that we are putting together a proposal for finance that should be going to them tomorrow or Monday with regard, hey, this is what we think we're going to need in terms of additional staff to get the assessments done as soon as possible. And so we don't want this backlog hanging over us. And we understand that it would be a tremendous challenge for our existing staff to do that. So in some cases, we're going to have to look at either stipending BTU staff and or looking at contractors so that we can address that backlog of assessments. I hope that wasn't too much.
And that actually brings us to our 5 minutes. The one question I think unanswered is the percentage of students on IEPs.
Yeah. Right now it's between 20 and 21% is the percentage of students on IEPs. And the one piece I would add to her question about how are they being implemented, it is
or how are IEPs being fulfilled, right? Students that have IEPs.
Sure.
Clearly, some people are not receiving services, some are. So what does that look like?
Yeah,
I can save my other questions for the next round.
Sure. So first thing to say on that is just that DESE has been really clear that IEPs are supposed to be implemented this fall. And if a student is not getting services, the family should be talking with their school. And of course, there are some services that can only happen in person, and that's going to be a challenge right now. So I think that the one piece I would say to that is that we have created individualized learning plans for each student who has an IEP in the district. They're about 90% done now and sent out to families so that we are able to, so that families really know what those services are going to look like.
Thank you. Thank you, Counselor Campbell. I'm sorry, when I'm hiding my face, I'm yelling at the children in my house. Counselor Wu has joined us. Counselor Wu, it's your turn.
Thank you very much, Madam Chair, and thank you to everyone. I joined a little bit late, so I caught some of my colleagues' great questions, but not all of them. So apologies if, just let me know if this already been asked and answered, and I'll rewatch the tape. I'm curious, just the biggest takeaway I have had over the last couple of weeks when it comes to this topic in particular is just it feels that there is no central source of planning around what is happening, particularly in a longer term time frame, and not even that long term, just even a couple weeks time frame. So could you just tell me, from an organizational infrastructure perspective, who is making decisions about how students' services will be delivered, about how this particular population of students and families are being brought into conversations? What constellation of people within BPS and who outside BPS is driving those decisions day to day and in a sort of longer term planning way?
Counselor Wu, thank you so much for your question. It hadn't been asked before. I'm Andrea Zayas. I'm the Chief Academic Officer, so I don't think we've met before, so just wanted to introduce myself. I'll pass the question over to any of my colleagues that want to add in, but I'll just say that the superintendent has convened a group of us. There's been a reopening task force and a reopening team working since the very beginning. In this new closure, we're investigating the possibilities for and planning how and to what extent we'll be able to provide in-person services to our highest needs students. And that group includes me, it includes Ethan, a number of members on Ethan's team as Assistant Superintendent for the Office of Special Education. We're working very closely with our educators, with school leaders, with school superintendents, and our Chief of Staff, Mary Dillman, is coordinating much of our efforts.
Sorry, I was stuck on mute. Oh, yes, please continue.
I might add, Councillor Wu, just that it's really important to understand that even in a pandemic, that all special education services need to go through, are individualized. And so it's a conversation, it's a school-based conversation between the school special education personnel and the families. And so I just want to, thank and call out our coordinators of special education who have really worked hard to create what are called the COVID-19 special education learning plans for each of our special education students in the district. And so the purpose of that learning plan is so that families know how the services are going to be implemented this year, whether it is in person, hybrid, or fully remote. And that is a conversation that happens between school-based personnel and families. And so each family has been reached out to have that conversation. And as I said, those are just about 90% done now. Now that we've gone back to fully remote, some of them have to be looked at again, but there should be an individualized conversation happening with what IEP services are going to look like in the remote environment.
And at what point is the district going to be looking at sort of a stable plan for the rest of the year, or even just let's just say starting from next school year, assuming that this may be remote for the rest of the year? Or how are we thinking about the spike and just giving some sense of predictability to families? Because I know, it sounds like from you all that there's a tremendous amount of work and outreach being done, but I continue to hear from family after family that there's just confusion and things changing and no way to have feedback taken into account particularly at the sort of larger planning scale.
Thank you, Counselor. I'd say that at the moment we are planning for all possible contingencies. The spike is something that, yes, was anticipated. The return to remote learning we planned for by ensuring that we had the district-wide infrastructure in place to ensure that remote learning was greatly improved from our spring experience. And we're hearing lots of feedback from our school communities, from our families, that is very much so the case. As we plan and pivot back to hybrid, and as we work really diligently to re-engage our reopening timeline and plan, we're working with public health officials to monitor the science. There's only so much predictability that we have right now. We're watching the numbers closely and planning right now as a team, along with our parent action councils, along with SPEDPAC, along with our labor partners, around what the various contingencies could look like, what the various plans could look like, so that we're not reacting 2 weeks from now or 4 weeks from now, but that we have a long-term plan that we can roll out and consistently communicate to the community. That is what we're working on.
So again,
So
I
if
know
we
you
could-
all are,
We've hit our time. Councilor Wolf, you've got a very quick follow-up.
yeah, if I could just wrap up the kind of, because I don't feel that many of my questions were really answered during this session. I think, again, I know there's an impossible situation that you all are dealing with, but I would love, maybe if someone could email me the exact people who are involved and who makes the final call on these. And I would just love to hear, you just mentioned that there will be a long-term plan rolled out. What date should families expect to see that done, and who will have had sign off on that plan?
We can make sure to get that to council.
Could you just tell me what date now, what's your best projection in this moment of what date that plan will be done by?
I will absolutely have to defer to the superintendent on that. I'm sorry, but we can absolutely get back to you with some, with the list of the team as well as with dates.
Thank you.
Thank you, Councilor Wu. During our reopening hearing on Tuesday, the superintendent was available, and I think that would have been a question for her. So let's make sure that gets forwarded. And in this hearing this evening, I'm going to put the timer on for myself as well. One of the challenges that we all face, and I face, many of these hearing orders as we've bundled them were called for pre-COVID to talk about implementation of services and programs and the work that needs to be done to vastly improve the experience that our special education students are receiving, and how we're making sure that high quality mental health services, et cetera, are reaching our kids. And it's hard to not overlap that with the needs of our kids and the urgent needs of so many of our students, especially students with special education needs during this time. So I think it's impossible to separate the two today, but I would like and appreciate the conversation to sometimes separate the two, because we need to improve inclusion services. We need to improve service delivery of dyslexia services to students with dyslexia, students with autism in regular days and sort of in the quote unquote normal times. And it's just become even more critical and more important during these times. So what I think, and through this conversation today, what I do anticipate is perhaps a smaller working session on each of these topics so that we can separate them from COVID in at least a little bit of a way. So my questions are many, but I do want to ask sort of generally, what is BPS's definition of a high need student, and how does that compare to the state's definition of a high need student? And what are the numbers of those students in that category? So our definition does these, the differences, and how many students fit that category.
Yeah, and I'm happy to speak to that. And our definition of high needs, it pretty much aligns with DESE's definition. Pretty much it aligns pretty closely with the DESE definition. On July 9th, they did issue their guidance with regard to what that what that high need category should look like. And they did give districts in terms of some discretion in defining that group. But we did make sure that we included not only students who are defined as high needs on their IEPs according to a form in the IEP, and not to get too technical, but the PL3 form has a box that says 1, 2, 3, or 4 that refers to a level of need. And so that's with regard to students with disabilities. But we also included, as they recommended, students who are homeless and or involved in foster care, and also students duly identified as English language learners. So, and I'm just pulling up my data with regard to how many in each group. And this is updated weekly, so it may have shifted a little bit, but it is, we included our, so this is with regards to substantially separate students. There may be someone else on the panel who can speak to the others. I don't have those numbers right here, but with regard to our students with disabilities, we have 376 students enrolled in public day schools. We have almost 3,400 students in substantially separate placements, and we have just 1,600 students enrolled in full inclusion settings who have that level 4 high need. So those are our students with disabilities who we've identified as having high need.
And do schools have an opportunity to add students to that list that they identify as high needs?
Yes, they do. So we've put in place a process so that students who may have just recently become homeless, who haven't shown up in our data system yet, who may have a new IEP, who may have, like, there could be all sorts of mobility issues that have led to shifting data. So yes, we have made sure that schools have the opportunity to do that.
Very good. And sort of separate from the COVID conversation, what efforts do we have underway, have we had underway, and will we have underway to really limit the number of students that we are sending to sub-separate classrooms? Because we've identified that as a real problem, and we've got too many, especially as compared to other states.
Yep, no question. And I think, you know, there are all sorts of reasons for that overrepresentation, some of which you've heard about. And I think maybe the biggest way that we're addressing that is through our culturally and linguistically sustaining work practices work that we're really doing in so many different places in the district, about making sure that everybody understands that every student is able to achieve at high levels, and that there's a huge opportunity gap, and we need to make sure the supports are in place for each student, and getting that mindset right, that all kids can really achieve at high levels. And so that's around the cultural work. And then, you know, that's happening both with school leaders and coordinators with special education, and us ourselves as central office leaders as well.
Yeah, and I think also adding, making sure that we're doing early intervention and early screening.
Absolutely.
And also, you know, we know we need to act, I think, more diligently around Black and Brown children in our district, disproportionately into those sub-separate classrooms, but also I have a particular interest in boys in those areas. Do we have the percentages of Black and Brown children in sub-separate classrooms and the percentage of boys? Male students?
Sub-sep. I have the overall numbers for students with disabilities. If you give me a moment, I can pull up the substantially separate settings.
While you're doing that, Ethan, I would love to just jump in.
Sure, please.
Add to the counselor's question that the definition of high needs during this COVID time was actually agreed upon in the MOU with the BTU. It also includes, in addition to the groups of students that Ethan was just sharing with us about, our SLIFE students with limited and interrupted formal education, as well as our English learners level 1 and level 2, and our English learners with disabilities. So the definition is fairly inclusive of and the groups, it's inclusive of all the groups that are mentioned in DESE's guidance, including, as Ethan said, students that are experiencing homelessness.
Great, thank you. Ethan, if you don't have those numbers yet, I'll move on to Counselor Flynn for his.
Okay, please do. If we come around
Thank
again,
you.
I can get them
Perfect.
then. Yep.
Thank you. Counselor Flynn.
Thank you, Counselor Sabi George. My question is, over the last 9 months, with students that traditionally would have been engaged with a one-on-one instructor, whether it's a physical therapist or a speech therapist or some other type of counselor, over those last 9 months, some of those skills that they have been improving on, have obviously decreased. What are we going to do in terms of trying to get that student back up to a level that they were once at, or continue to make improvements. Even though we lost 9 months, what will the plan be to overcome that period of time to help that student get back on track?
Yeah, Councillor Flynn, thank you so much. Such an important question. Really, really appreciate that. So DESE again has created a new structure to address this question, which is something called COVID-19 compensatory services. It really is distinct from what we have thought about compensatory services in the past, because it is simply defined from March 17th, when we had to shut down, until June 21st, in addressing the learning loss that happened during that time. So we just had a professional development with our coordinators of special education to talk about the meetings that need to happen, just like the learning plans, with regard to how IEPs are being implemented. We are also need to have individual meetings with each family about these compensatory services. And it's important to point out that families should have input in those meetings. And so some of those meetings are getting started now, but more will be happening shortly in the future, because what we want to finalize is what we're going to be able to offer to recoup that learning loss. I do want to say one important thing about that I think is really important, is that it is not just, oh, I missed 10 speech sessions, therefore I get 10 speech sessions, I should have 10 other speech sessions. It is about the amount of regression that the student experienced and what it would take to recoup that learning loss. So in some cases, it could be more, right? It could be like, oh, he's regressed so much, he needs more speech services. But it could be actually, as has happened with some families, not everyone, but some families, remote learning actually worked, and he was able to make some progress with regard to his rules-based reading, for example. And that in that case, you might not need as many rules-based reading sessions to get caught up. But the important point is that it is about recouping the learning loss. It's not I missed this service, so I get more of it.
Thank you. Councilor Sabi-George, I don't have any further questions. Thank you.
Thank you very much, Councillor Flynn. Next is Councillor Mejia. Councillor Mejia?
Yes, thank you, Councilor Sabi-George. I'm sorry, I didn't realize about the 5-minute rule this time around, so I thought I had more time, but I appreciate knowing the process has changed. So forgive me for trying to press on with some additional questions. But I waited my turn. I do have some questions about the mental health professionals who are currently working at BPS and how they're dispersed throughout the district. Are there any plans to hire more in the coming year? And how are we being intentional about hiring mental health specialists that reflect the demographics of our student body? I did a lot of work back in the day in the education space, organizing parents around the importance of social and emotional learning, as we know. Oftentimes, from what we heard is that not every school is doing it. So I'm just curious. I'm going to ask a question around social and emotional learning, but for right now, let's just talk a little bit about the mental health specialist. Who can answer that question?
Hello, this is Andrea Amador. I believe I can answer that question for you. So in terms of the staff and behavioral health services, I had mentioned a little earlier that our staff speak 11 languages and that, 28 of the staff and behavioral health services are bilingual and bicultural. We also have 2 Latinos as supervisors in our department. Additionally, when we did the hiring for the transformation social workers, a great deal of intention was put into ensuring that we were hiring transformation social workers that reflected our students and families. And Carmen O'Hara and her team did a wonderful job, and 78% of those hired were diverse candidates. So that answers.
That's great. Thank you for that.
Yep, thank you for that. I'm hyper-focused on my little 5 minutes thing here, and I want to get to another question, so I do appreciate that. Sorry. So I'm just curious, interpretation translation is also an issue that we hear from a lot of parents, specifically around IEPs. And so I'm just curious about what the district is doing to help support the special education and teachers as it relates to the translation and interpretation supports. This is in the special education department.
Sure. So we work.
What we see is, yeah, go ahead.
Go ahead. Yeah. I had a number of conversations about this already this year. I wish someone from OEL were here, and if there's someone on the panel who can address the investments that they've really made in the translation and interpretation department, that would be great, because I know they're substantial and incredibly important. Language access and language justice is really important, particularly at a place like IEP meetings. Really, really critical. And it's, I've been in a number of meetings already with Councillor Flynn where we have run into this issue, and it is really, it's devastating when a family can't have access to the incredibly important information that is shared during an IEP meeting. So we work very hard to make sure translators are available, and also have a new text program called Talking Points that I can't speak to the details of, but if we had someone from OEL, they might be able to.
Yep. Thank you. So my last, and then I have one more question, and I'm not sure how much time I have left, so I want to get it in. I know someone else wants to say something, but I just want to get my question in, and if there is time, then we can hear a little bit more. In the city of Boston, we're still overcoming a lot of racist systems, as we know. For those who have grown up here in the city of Boston, the trauma that exists in this city as it relates to our segregated schools is real, and it's hard to live and learn in a city where you don't really feel that there's a lot of racial union, I guess, if you will. That is really traumatizing. So I'm just curious, how are we incorporating racial trauma into our social and emotional learning services? Anyone could answer that.
Thank you, Councilor Mejia. I'll pass the mic to Assistant Superintendent Jill Carter to talk a little bit about our trauma-informed training this summer as we prepared for reopening, to make sure that our teachers were well prepared for CEL and trauma-informed practices, and perhaps to Andrea as well to add any particular training that was provided as well during that time, and ongoing supports and services.
Yeah, I want to dive into the racial trauma, though, in particular. That's what I'm really looking to learn more about.
And just to clarify, Counselor, I heard you at the end, I think, say related to social emotional services for students. So the services work, I would defer that to Andrea because of she oversees and trains the mental health service folks. But I would just say that from a social emotional learning competencies and skills and curriculum, we are taking an intentional transformative CEL approach, which is based in equity and firmly planted with the idea that we want everything we do to be anti-racist, to build on students' assets and to support them, taking more of a healing-centered approach. We did do a lot of different trainings this summer for all kinds of staff, but I'll turn it to Andrea so she can maybe be more explicit about the mental health support services team.
Thank you, Jill. I'll build on what Jill's saying. Here, our department provides over 200 professional development learning sessions to educators, often at the request of the school principal. This summer, we offered a training to all school staff, including principals and teachers, on healing-centered engagement and helping them to understand the impact that trauma has had, the racial inequities trauma, as well as the COVID and COVID-related closure trauma has had on our students, so they could start the year really centered in how to approach students with a healing-centered engagement lens and incorporate that into how they're building community in their schools.
Thank you. And I don't want to occupy any unnecessary space. So Councilor Sabi George, I yield the rest if I have any time left over. Thank you guys for your answers. I appreciate it.
Thank you, Councilor Mejia. Councilor Campbell?
Thank you. So I just want to say respectfully to you, Madam Chair, I know that many of these hearing orders were filed before COVID, but now the reality has changed, of course, and I do view these hearings as an opportunity to hold the district accountable, because frankly, the fact is we have a large majority of Black and Brown students, low-income students, special needs students, English language learners that are not receiving adequate educational services right now in the midst of a pandemic. And of course, are going to experience a tremendous amount of learning loss along with every other student in the district. And so my line of question I want to just go back to, which of course have to do with COVID, is we know right now that there are families that are, there's a delay in the assessment process. So my question is, at what point will we sort of recover so there is no delay? And I appreciated you, Ethan, talking about additional supports that have been put in place to make that happen. The second question is, we know, of course, there are students right now who are currently on IEPs that are not receiving their services that they, of course, are legally entitled to. When will we get to a place, timeline-wise, to ensure that they do get their services? And then my last question is, obviously we're all devastated there's no in-person instruction, but it's abundantly clear that some students with IEPs, some English language learners, and some others absolutely require in-person instruction for some of their services. Where in the country, where in the Commonwealth, what other school districts right here in Boston, whether it's charters, private, parochial, whoever, who is doing in-person instruction right now that is meeting the needs of these students, and how might we sort of look to some of those districts for best practices to finally get a plan in place that meets the needs for these families right now? Because we're clearly behind the ball. But thank you very much. Those are my questions.
Thank you so much, Councilor Campbell, for those questions. And with regard to assessments, just with when do we think we will be caught up? So when will that backlog be addressed? As I said, we will have literally the end of this week, I think that we will have a final date of when we think we will have that backlog addressed by the middle of next week, that we'll have a date. We are trying to figure out what the investment needs to be to get it done at various dates. If we invest this much, we'll be able to have it done by here. If we invest this much, we'll have it done by here. So we are at that stage, and we need to have a conversation with finance about what we're going to be able to invest to get that done. So your office can expect an answer on that by the middle to end of next week. With regard to IEPs being implemented and how, I think it's really important to say that, that DESE has said that IEPs need to be implemented. So I don't want to, by default, say because we're remote, there are some huge number of services that are not being implemented. There may be some. I'm not saying there are not any. There is no question that there are some services that need to be in person, but we have found success with some services being implemented online and virtually that we might have not thought possible before. So physical therapy.
No, I understand that, Ethan, and I'm just being mindful of time. I understand that. Where I'm focused on is where we're not meeting the mark, right?
Yeah.
So, right. So just I'm looking at the time. That's another reason.
Yeah. Okay. Absolutely. And yeah, I hear you. So fair enough. And where we're not meeting the mark is where those compensatory services are going to come up that we need to address as well. So and we will be having individual conversations with families about those compensatory services, and we're ready to make an investment in that as well, because we know there has been learning loss. We're not naive and trying to say everything's going well and perfectly, and so we're gonna address that and make that investment. And then lastly, with regard to in-person services, the variety of approaches that different districts have taken is amazing, right? And so we were talking about Waltham, Quincy, Worcester just this morning in a team meeting and trying to figure out what they're doing and learning from them and what we can do as an approach. And so, and people are reaching out to us as well because they were excited. Hey, you got kids back in the building. How'd you do it? What did it need to look like? So there is a learning community of special education directors and administrators and superintendents trying to make this work for kids.
So then my last piece then is, you know, knowing all this to be true, there are gaps in services we're not meeting right now, which is unacceptable. There are people out there who are doing this quite well. What are the barriers to our system in delivering on the services for this population of students in particular? What are the barriers to us getting this done? Because it is beyond frustrating that we haven't been able to up to this point. And then of course, this is a comment, not a question. My comment is similar to what Councillor Flynn raised, which is important, which is once we figure this out and hopefully get it so it's excellent, everyone receives their services remotely, in person, hybrid, whatever, we get that right, then of course there will have to be immediate planning on making up for the learning loss that has occurred and will continue to occur, not just for special needs students, English language learners, but also every student in the district. But what are the barriers for us getting it done?
Yeah, I think, I mean, we are, as many of you know, we're working hard at getting our, to start with. And I know people don't want to hear, like, we think getting our day schools open is really important. And by that, I mean all 3 day schools. And so we're working with those school communities to figure out what that can look like. And so we have to work with our union partners to figure out exactly what that can look like, with our school leaders to figure out what that can look like. And we're hopeful that we can have a really aggressive timeline on that. But I would certainly defer to Ms. Zayas or the superintendent to speak more directly to the timeline on that.
The timeline, as we talked about a little while ago, we will get back to you on that. I think the only thing that I'll add there is that we are working closely with our labor partners to think and talk through under what conditions and how and to what extent we can return the staff that would need to be present to serve our students, and to really, just begin welcoming them back, doing the assessments that are necessary, as well as providing in-person services. We've got to develop that plan cohesively, collaboratively with educators and with families and with our school community, so that work is underway.
Thank you. And I'll just end with this. I think I've expressed my frustration, and because, early on I said remote, phase in approach to, those who really needed it. And now I just feel like we're so behind the ball. And we, of course, are fielding calls and emails from so many families, community partners as well, who are beyond frustrated because we haven't figured it out. I continue to want to be a partner, of course, in this work, and to keep pushing us to get this done, frankly, like yesterday. But thank you for all of your hard work. I know it's not easy. Thank you, Madam Chair.
Thank you, Councillor Campbell. And it wasn't so much that we couldn't ask questions related to COVID. I wanted to remind colleagues that we could ask questions not related to COVID.
Thank you.
So, Councillor Wu.
Thank you, Madam Chair. I just want to, I guess just to take a step back, even as a parent, it's been incredibly frustrating feeling like there is no real plan. We're now more than a month into the delayed start of school, and for families of students with disabilities for which this is a necessity and legal obligation, it's really jarring to hear that there's not even a specific timeline for when there will be a plan. So I just want to take the chance to, as a learning opportunity, just understand from my own knowledge to go back and diagnose a little bit of what has gotten us to this point. So could you just explain why more of this planning, the assessments, the outreach wasn't done in the summer months when we knew that this would likely be the trajectory of COVID in the city and spiking now, and so could you just why wasn't this part of it done much earlier?
Councillor Wu, are you talking specifically about the special education assessments?
Yes.
So with regard to the special education assessments, as soon as we had staff back who do the assessments, we were able, within 3 weeks, we were able to get some of those assessments started. So part of the problem is that we were in fact closed for assessments in the springtime from until June 21st. And then over the summer, we don't have the team to do assessments, but within I think we started assessments at the Endicott for early childhood, the very end of September, might have been the beginning of October, but we've been up and running for about a month now on assessments. So, you know, I understand the frustration around the backlog, but I do think that we are going to be able to address it certainly before the end of this year, and maybe before the end of this school year, and hopefully before that. So, and certainly hear the frustration around that. But once we got staff back, we were able to get up and running. And then, and also, now that we are shut down, we still have folks working really hard to get it done, even when we're not able to compel them to do that. And so, you know, we're really thankful for that, and, you know, understand the dedication of staff to do it.
Yes, absolutely. Is that the plan as well for this next summer going into the next school year, that this will be a repeated timeline with a huge pause in the summer months and then spilling over far into the school year?
No, I don't think so. I mean, we'll have to see where we are in terms of the data. We're doing good data analysis to understand where how many need to be done and where they need to be done. So we believe we're going to be able to assess next summer, now that we can plan for this and understand exactly how to do that, where and who and what it might cost. We believe we will be able to assess this coming summer if needed to finish off the backlog.
Okay, and then I just want to flag, I mean, I've been in many conversations similar to this now with the district about where the barriers are and where the delays are, and there's often a sort of reference to bargaining and the union and educators and the many stakeholders involved. It doesn't match the conversations that I'm hearing and having with educators and with folks who are saying that there really has been an urgent effort to start these conversations much earlier, to accommodate any possible way of coming to plans, even proactively putting plans out there. So my read from having many conversations is that there needs to be much more accountability to the district holding itself, you know, whether it's the school committee holding the district accountable, the council, et cetera, that this timeline doesn't match at all what families are experiencing and the urgency of what is happening, nor does it match the urgency with which educators want to see this resolved. And so I'm still, you know, I'm grateful that you all are willing to, and we'll be following up with that information about the plans and the timelines. It's you know, beyond frustrating that we are having to ask for that, you know, now a month into the school year, and I don't sense the same type of urgency from within the district. And then, so a more specific question about the Horace Mann building. Could you just talk a little bit about that facilities plan and where that sits? You know, it seems that it's falling a little bit under this department, a little bit under that one, and there is that the facilities plan is holding back the ability to come up with a specific plan to deliver services for students.
Counselor Wu, our operations and facility team is not on the panel this evening, but we can take that question back to them. I'll just share that in none of the conversations that I've been in have I heard that there is any delay around the building itself. So, you know, conversations with the school leader and with that school community are ongoing to determine feasibility along with the BPHC for reopening.
Is there swing space identified for the school community already?
Well, we do have a facilities hearing in a week and a half or so. where we can get that specific information about facilities, the facilities plan for the longer term for the Horace Mann.
Yeah, I'm here. I'm trying to, and I will certainly make sure to re-ask then. I'm just hearing a lot of frustration from students, families of students with disabilities, particularly around this facility situation. So it's kind of spilling over into both, and
Yeah.
particularly around the issue of swing space not being identified.
Thank you, Councilor Wu. And I'll add that to my list of questions here to follow up with the district as well, so that they have that for that next hearing, if not before. And I will set the timer for myself. I've got a couple of questions. One quick follow-up on the use of the space at BLA and the Endicott. What protocols are being put in place to make sure that those evaluations are happening in a safe environment?
Yeah, so there is full PPE available there. It is, so number one, full PPE. We have the plexiglass as well, dividers that we use to make sure staff and families and students are safe, as well as it's by appointment only. So, you know, there are limited people in the building, and we're able to do contact tracing as needed. And so what would happen if you have a speech assessment, for example, the speech therapist will call you and set up that appointment for you to come in. And so it's really that you understand the protocols when you come in as a family, and all the standard protocols are being followed. I also, if you wanted, I just want to pull it up, if you would like the substantially separate numbers.
Yes, please.
Okay, so district-wide, 39% of students are Black or Latinx males. 56% of students with disabilities are Black or Latinx males, and 62% of students in substantially separate settings are Black or Latinx males. So clearly there's a tremendous disproportionality, and that's what we started with and certainly want to address.
Great, thank you for that. I appreciate you continuing to look for those data points.
Yeah.
So a couple of quick questions. One for, I think, Andrea or Jill. How many schools don't have a full-time mental health provider or social and emotional support specialist on staff for that school community? And what would the cost be to make sure that we did have one at every school, similar to the nursing piece? At least one full-time mental health professional, social emotional support specialist at each school.
So hello, I'll take that question. Currently we would need 48 school psychologists at a cost of $4.8 million to have a school psychologist in every building. I just want to clarify though that we also have our transformation social workers, and they're in, trying to scroll to get you that number, 35 schools. So those schools, my apologies, they're in 30 BPS schools have a full-time social worker. So that would,
the rest of the schools would need a full-time equivalent, or?
It depends on which mental health position we are funding. So again, we'd need 48 if we wanted a full-time school psychologist in every building. Mm-hmm.
I get you. And then if we wanted a social worker in every building?
There are currently 30 transformation social workers. We know that there's additionally some school-based social workers that principals have hired with their budget.
Okay.
So I would defer
to a little bit of math there.
Right.
Okay. All right. That's something that I'm really interested in, both the numbers of professionals that are in buildings. And, you know, I have my personal preference on what type of provider I'd like to see full-time in each building, but that personal preference is less important to me than making sure that we have at least one licensed person to support our use. Go ahead.
Hi. Thank you for asking these important questions and having us today. So we currently have 107 social workers across the district performing in a variety of roles. Some of them are the transformation social workers. Andrea mentioned some of them are staff who work with students in emotional impairment programs and other specific programs for students with disabilities, in addition to, as Andrea mentioned, a significant number of school psychologists, and her numbers obviously speak for themselves. In terms of the number of schools who have a full-time social worker, including the transformation social workers and the school-based social workers that Andrea was mentioning, there are 57 schools total. The information I don't have for you today is the overlap between the schools with full-time school psychologists and full-time, so I have to get that.
Yeah, no, that's perfect. I appreciate that. And I do think my earlier comment about going to maybe smaller working sessions on each of these topics, this is a great overview because there is so much overlap between these topics, but to then dive down a little bit deeper. So my other question, I have a couple more quick questions and I'll just ask them and then we'll wrap up this section and move on to our next panel. I am curious, I'll rattle these off and if we can get to some answers, short answers, that'd be helpful. What guidance is the Boston Public Schools providing to teachers around implementing SEL remotely? Also, I'm just curious about with inclusion and dyslexia and autism specifically, how do our numbers of students and our numbers of students, providers or teachers and support staff per students, how does that relate nationally to the national numbers and how does it relate to the national standards? And then also around the dyslexia, what are the teaching methods that we're utilizing as a district? And then how many teachers are trained in those methods? So SEL, how are we supporting teachers around SEL remotely?
Yep, sure. I'll start with that and try to be short. So we are offering professional development specifically targeted to supporting teachers on how to create social, emotionally supportive environments online. And so those are trainings that are available to all staff. We've also, through our reopening guidance, put out some expectations that teachers will be using routines, rituals, and relationship building strategies regularly in their daily teaching. So I'll stop there.
Thank you. And then some of the numbers around inclusion, dyslexia, and autism. Oh, Ethan, you're on mute.
Yeah, sorry about that. My daughter's having drum lessons. As I think I said, that with regard to inclusion, it's not so much the percent in inclusion as it is the percent of students in substantially separate setting, and specifically the percentage of special education students in substantially separate settings that is high in Boston and that we have concerns about nationally. We did just get these questions last night. We're happy to provide the more specific data with you and would love to go over with them and hear your perspective on them. I think with regard to autism, our understanding is, and we can get you more details, that we're in line in terms of the percentage of autistic students and the identification thereof. And with dyslexia, that would be my understanding, although we can look at that data in terms of the identification. And then in terms of what we're doing in terms of dyslexia, really we've made a substantial investment in Foundations, which is a program of Wilson reading system, and it's really a large investment in early literacy and trying to address those things up front, which is probably the most proactive thing we're doing to address early reading issues.
And then how many teachers are trained in Wilson? And are we doing any Orton Gillingham?
Yeah, so we have ongoing each summer. I can get you specific numbers. I don't have them right now. Happy to get them to you, but each summer we do have teachers who are trained in both. So we can get you those numbers. I think this summer I just since
you're getting the numbers and we can talk about it, I think more deeply in a
Sure.
working session, I'd be interested in sort of the geographic distribution of those teachers, sort of where they exist, what schools and in what communities.
Sure. Yep.
So unless any of my colleagues have a pressing immediate question that they'd like answered, I will move these topics all into smaller working sessions. We do have another panel that I'd like to get to. Do any of my colleagues have an additional question? Great. I do want to thank you very much for your time. I know a few of you were tuned in to Tuesday's session, so I'm grateful for your time this evening. As we bring in the next panel, I will wish you all farewell.
Thank you.
Thank you. Good night.
So welcome to the next panel. I appreciate you all being here and would love to just introduce yourselves and get into testimony or presentation. We do have Jessica Tang, the president of the Boston Teachers Union with us, Victoria Downs, who's a school psychologist at the McKinley Schools, Kafunda Banks, who's an ABA specialist at the Curley K-8 school, and Shantae Alves, who's a pre-K inclusion teacher at Young Achievers K-8 Mattapan. I think I got everyone's names pronounced correctly, but correct me when it's time for your remarks. I'll start with President Tang. Jessica, welcome.
Thank you so much. And I just wanted to thank you and Councillor Flynn for sponsoring these really important topics, and couldn't be more timely in terms of our priorities right now with both social emotional learning and our special needs students being at the top of our priority lists. And just wanted to also acknowledge Edith and Roxy earlier, because as they shared, you know, we are absolutely aligned with our parents and our community activists who are asking for a better, safer plan, particularly for our highest needs students. And actually, over the last several years, we've been fighting very much for these topics. So for example, in our last contract, actually the one prior to that, we had fought for restorative justice and restorative practices and a restorative justice coach for the district. And previous to that, had been working on grants with BPS on how to get more restorative practices in our schools. In the last contract, we also were fighting for inclusion done right, and I'm going to get back to that. But as you pointed out, Madam Chair, the nurse in every school was a priority in our last contract as well. And thankfully, you know, with your support and others, we were able to win a full-time nurse in every school. And how timely was that? I really can't imagine how much harder this year would have been if we hadn't already won that in the last contract. And so these continue to be incredibly important issues. And I'll also say in terms of high need students, we also fought in our last contract and won additional funding. And I know this is an issue dear to your heart too, Madam Chair, around supports for homeless students. And luckily, we were able to win some additional funds, and thank the council for approving those funds in our contract so that we could be a little bit better prepared for this situation that we're in now. So it has, so those are some things we did over the last year, and then I'm going to bring us to March. So beginning in March, when remote learning was first called and school buildings were closed, we continued to advocate for our highest needs students. And so we called for focus groups, and the district did join us in those focus groups where we had a focus on CELWEL, again, a lot of these topics, EL students, high needs students, and we're trying to get the best practices and sharing around what did and didn't work and what our educators needed moving forward, both through the summer and the fall, to be prepared for what we knew was still going to be a difficult school year in the next fall. We also had proposals for extended school year. Again, early on when we had already talked to our educators, we knew that there were going to be issues with compensatory services, evaluations, assessments, and the backlog. And so we had suggested that they identify the safest buildings possible and get in-person services and those compensatory services done as quickly as possible so that we wouldn't have so much of a backlog in the fall. Unfortunately, those proposals that we'd made were not implemented. And then in August, we also made another proposal for hybrid learning because we knew that hopscotch wasn't going to work. We also knew that our number one issue around safe facilities was not going to be adequate with just an open window and fans, particularly as the months were going to get colder. And so we advocated for air purifiers instead of the cameras because we knew that the cameras were not something that educators had asked for or wanted, because we knew simultaneous teaching wasn't going to be good for both our in-person and remote students. But unfortunately, we did not get those ear purifiers. However, in the last few weeks, we were able to convince the district, and with the mayor's help, they purchased 500 air purifiers that were supposed to be for the medical waiting rooms and the nurses' offices. And I know 250 of them, they said, came in, and 250 are apparently stuck in customs, but there are certainly other air purifiers that can be purchased. We just recently bought some from Best Buy in our office. And so we hope that that might be a solution again moving forward in order to have safer facilities. So those are some of the things that we've been advocating for. Again, we are absolutely devastated and brokenhearted that our high needs students had any interruption in services because it was absolutely avoidable. And we are continuing to be at the table and wanting to be at the table, actually, I should say, and have continuously asked to be a thought partner, share our solutions, and collaborate. We did have some success with that with the reopening task forces, and unfortunately they're no longer meeting, but I would hope that they could continue because, again, we think the best solutions happen when we're able to bring together our incredible educators, many of, again, who are going to testify tonight, and Kafunda and Victoria and Shantae being some of our exemplars of those educators with solutions. And we continue to want to be partners because, we all got into this work because we love our students, and our students have always come first. They continue to come first. And we are looking out for their safety and, of course, the safety of our educators and also the larger community. And we've been asking, and we continue to ask for very, I think, reasonable ways that we can get our students back in for in-person services. Again, the PPE, of course, is important, but even on October 1st, our nurses didn't have the right PPE. That's why we were very concerned. We were concerned because in the 7 days, they did not report publicly that there were positive cases, and there were. I think by the time schools closed, there were at least 10 confirmed. We also had been asking for the air purifiers, and those could have been in place already, not just in the nurses' offices and medical waiting rooms, but in other situations. We had said we need them for our special needs classrooms where students can't wear masks and they can't socially distance due to their disability, or due to the fact that they need to see social cues and facial cues, and the mask prevents that. For our deaf and hard of hearing students, we needed clear masks, but honestly, once they got those, they found that they would fog up, and that really was not helping their instruction either. And so the better solutions were identifying safer facilities with adequate air filtration and ventilation. And for the schools, again, we only had 35 that had HVAC, and all of those do not actually have the capacity to hold the MERV 13 filters, so that are the minimum requirement for filtering out the virus. And the air purifiers were a solution that we had offered very early on. And in addition to that, the instruction has to be better. We cannot continue with simultaneous instruction because, again, that doesn't help. That's the worst, literally, of our remote and in-person instruction. We've got to have a better plan for that. And then testing is another thing, a very reasonable ask we've asked for. In Cambridge, we know that they have take-home test kits for educators, and they can do their own swabs and then mail them in and get quick results. And these are all, again, reasonable asks that other districts have already implemented, and so that we've continued to ask for our district as well. So again, that we can get our highest need students back in, because we are very aware of the challenges. And again, a lot of our educators are parents of high need students themselves. And so we absolutely want to get them all of their services and their IEP goals to be met in the best way possible. So that's a little bit on the first few topics. Again, we've had for several years now, actually, an Inclusion Done Right committee, and I know Shantae and others are going to be speaking more about our advocacy work on that. It was very unfortunate because in our last contract, there was a promise and an MOA that we would have a better plan for inclusion beginning this fall. And we literally were about to sign something when the pandemic hit, and then the money that was set aside to implement that inclusion work just disappeared. And since then, we have not been able to resuscitate that inclusion agreement that we were literally on the brink of signing. In terms of the autism service, I know that Victoria and Kafundor will speak a little bit more about that. But I'll just quickly wrap up and say, I do like to give credit where credit's due. And I do think that one department that has, I think, done a great job of providing the adequate social emotional learning, professional development, and also framework and services is the behavioral health department, and really has been exemplary. And we also join you in your call for a full-time mental health provider, counselor, and social worker in every school, and hope that we are be able to accomplish that in the next contract, and certainly ask for the council support in reaching that goal, because they do incredibly important work and have been incredible partners throughout this whole situation. And then lastly, just on I do appreciate that the district is moving towards Wilson and Orton Gillingham in terms of helping our students with dyslexia. But one concern I still have is we have for many, many years, even since when I started teaching in 2004 or 5, adopted Lucy Culkin's curriculum. And for those who are paying attention, there's always been this reading wars on whole word versus phonics and decoding. And, even Lucy Culkin's Center now is taking back and walking back actually their pedagogy and instruction and practice, and saying that actually phonics is necessary. And so, but we have tons of Lucy Culkin's curriculum across the district right now still. And so that's, I think, an important area to address in terms of how we continue to move towards the science behind reading and learning and the importance of decoding and phonics versus now very much debunked alternate pedagogy, which even Lucy Culkin's Institute herself is walking back. So that would be my last point on that topic. And again, just appreciate the opportunity to share our advocacy work and what we've been doing to help our students and help our educators, help our students, and work with families and parents to provide the best possible education, even during this pandemic.
Thank you very much, President Tang. Next, we have Victoria Downs. I also want to note we've been joined by Councilor Flynn. Victoria?
Hello, Councilor Asabi George and all City Council members. My name is Victoria Downs. I am the school psychologist at McKinley Elementary, McKinley Middle School, McKinley Preparatory High School, and McKinley South End Academy. Today, I'm here representing a dedicated group of school psychologists and social workers of the Behavioral Health Department of Boston Public Schools. As the global pandemic continues, our students and families live through disruption in schooling, fear and uncertainty, and loss of what normal used to be. At our schools, as our schools have recently been closed due to rising rates in our city, there's a rising amount of anxiety and apprehension for everyone in our larger school community. The social and emotional aspects of transitioning back and forth from home to school and back home again, combined with the universal trauma to students and staff, cannot be taken lightly. As leaders within the mental health field, district social workers and school psychologists are on the front lines for emotional and behavioral management. In addition, there are many other services we provide to the students of BPS. Our department is responsible for psychoeducational evaluations, sociological assessments, and counseling services for students. Our department is the primary crisis response team in the district, and we're members of our school student support teams where we help lead the work of multi-tiered systems of support. Currently, we have 72 school psychologists and 6 district social workers to lead the work in proactive and crisis mental health services in our district of over 51,000 students. For the past 6 years, the members of the Behavioral Health Services Department have advocated for one school psychologist, one social worker in every building. Without it, many school communities will struggle to receive the appropriate amount of assistance and support that they will need. Additionally, as advocates for social justice and equity, we must work to direct the appropriate resources and support to students and families who are impacted most by this crisis. This pandemic has been able to shine a light on the importance of mental health services, both preventive and crisis support. And in that, we remain steadfast in our commitment to the students of Boston Public Schools, who deserve a dedicated school psychologist and a dedicated social worker in every school building. Thank you.
Thank you, Victoria. Next, we have Kafunda Banks. Hi, Kafunda.
Hello. Thank you, Councilor Sabi George, and to all the counselors who are present today. I appreciate the opportunity to be able to speak to the services that affect our children with autism in the district. The program of applied behavioral analysis has had a controversial start in the Boston Public Schools when it started over 20 plus years ago. It was a new therapy for children on the autism spectrum that many educators never heard of, and those who did were skeptical. But parents in the know demanded and pushed the district for this little known therapy that was evidence-based, data-driven, and through that data could prove that it worked. And for many children, it did. Children who struggled in classrooms and at home with the most rudimentary things, such as learning how to use the bathroom or wash their hands. These children learned how to do those things. Children learned to learn. They recognized letters and numbers. Children on the spectrum learned to read and write. Children learned how to say mommy at the age of 5 years old for the very first time. And I actually was there for that when a mother broke down in tears in front of me because of her son at the age of 5 called her mommy for the first time. But the parents who were in the know tended to be from the same demographic: white, wealthy to upper middle class families, and able to hire advocates and attorneys to fight for a therapy that was shown to work. Many had a sample of this new therapy by hiring teams of ABA therapists and consultants to work privately in their homes when they chose to keep their children home rather than send them to schools for programs that they thought were inadequate. It was to many of these types of families that I personally worked for before I came to Boston Public Schools. I worked on the South Shore, in Situate, Cohasset, Marshfield, Hingham, and Duxbury. One family that I worked for in Hingham offered to take me to their summer home on Nantucket Island so their child would not miss a day of therapy. For a long time, ABA was only available to such families that could afford to front load a whole program and then hire legal power to fight school systems to provide these vital provisions for their children. And then Boston Public Schools did something trailblazingly unique. The district, at the behest of parent advocates, adopted their own program. And for the first time in the state, a public school district was offering ABA services to all autistic students, not just those parents who could afford to fight for it. The Boston Public Schools ABA program has come a long way in the 20 plus years in offering a very vital program to all students, no matter their social economic background. And in those years, we have seen how these programs have impacted families for the good, but there is still much work and quite a ways to go to ensure equity for all. As we heard this evening, there are far too many Black and Brown students who are diverted into substantially separate ABA classrooms when they would be better served in inclusion classrooms that are fully funded. We need to better understand the delineation between what is labeled as behaviors and what is the result of trauma. Programmatic support should include an accurate design of what makes an ABA or an inclusion classroom function successfully. Staff members, all staff members, teachers, paras, ABAs, related services, and specialists need to be properly trained and well-versed in the tenets of behavior management and functions of behavior in every student program objectives. There should be a track of program development that will lead to the least restrictive environment for a student if possible, as it is their right to have such an environment. Parents should be adequately informed and educated regarding their child's needs and rights as a student in the BPS school district. And with that education, they should be empowered to advocate for their children. During my years of service, my 20 years of service to BPS, I've also sometimes wondered why IEP meetings didn't often come from a place of proactivity. The conversations usually seems more focused on what we can't do or what a student does not do. and how the conversation is quite different if a parent is present with the lawyer or advocate. Would it not be to the benefit of all if we just designed and funded programs that serve students with autism robustly from the very beginning? For instance, what would a well-funded inclusion program look like? A well-funded program could look like one with educational leadership at the helm, with cultural awareness of what it means to live in and be educated in an urban community, where there are more educators to provide for students with special needs, as well as gen ed students, rather than educators with more licenses. Where students have professional development time, where educators have more professional development time on how to educate students with and without disabilities. Where teachers, ABAs, and paras have time to collaborate and plan on how to meet the needs of students in order to create programming for high quality educational experiences. And where the school culture embraces the notion of providing an inclusive education to all students. Would this not be a most cost-effective program in the long run? Would it not be more defendable and a show of good faith if it worked to these ends? Thank you.
Thank you very much, Kafunda. Then we have, is it Shantae Alves? Welcome,
Correct.
Shantae.
Thank you. Yes. Good evening, Madam Chair. My name is Shantae Alves, pronouns she, her, hers, and I am a 7th year BPS pre-K inclusion teacher. I am here speaking on behalf of the Inclusion Done Right campaign as a proud B2 member and an Inclusion Done Right committee member. This advocacy is not brought upon by COVID-19, but highlighted. For years, months, weeks, and days leading up to the March building closure, as President Tang mentioned, we have been advocating for creating classrooms and schools with sufficient educators, not licenses, that make it possible to meet the needs of students in inclusion settings, with the priority on bringing together educators and families to build a strong, inclusive culture, as well as stopping the disproportionate assignment of students of color to these segregated settings. In June, Boston Teachers Union members voted on and passed multiple times a rank and file member authored anti-racist resolution that states what the union is committed to doing. It reads, and I quote, "Therefore, the Boston Teachers Union will continue its Inclusion Done Right campaign that has found that Boston public school students of color are disproportionately placed in segregated settings and overrepresented in our special education system. Inclusion Done Right demands that students of color, particularly African American males, deserve high quality inclusive schools that include multiple staff rather than multiple licensed teachers. All students, but especially those with disabilities, deserve teachers with whom are trained and experienced in de-escalation techniques to access curriculum in the least restrictive setting possible." End quote. When the district failed to plan for a potential reclosure of school building, it perpetuated the school to prison pipeline. Lack of a plan for consistent services in the event of another closure does not promote equity, but is racist and illegal. The law states that students, especially students with individual education plans, deserve the least restrictive environment. Interrupted services is the most restrictive learning environment. Failure to plan for the continuation of services in the instance of school buildings closing does not send a message to special education students that their educational success matters to this district. How does that align with the transformative social-emotional learning and wellness message BPS was mentioning earlier? Data from the SEL research schools was mentioned as well that can be directly tied to the grit of the teachers, not the district. Yet again, teachers are modeling the instruction and behaviors expected of them, while district leaders and administrators proudly share the data where with their behaviors, policies, and lack of positive action showing where their heart truly is. The hypocrisy. SEL is not just academics, it's relationships. And the relationships BPS has with its special education students, families, and educators is toxic. What is most troubling is that I hear of extra support being provided to students that do not look like me. Students in Roxbury, Dorchester, and Mattapan are in understaffed, poorly funded schools and classrooms. The district's lack of action regarding equitably distributing support has caused the remote learning experience to be all the more inequitable and taxing on the students, families, and teachers. When there is no paraprofessional special educator supporting each inclusion classroom, students' needs are not being met. Dual or triple licensure does not make up for quality instruction. The Boston Teachers Union and its members and the members of the Inclusion Done Right Committee have been fighting for months, now more than half of the year, for high quality special education services and safe spaces during COVID-19. Yet students and educators were forced into inequitably staffed classrooms in poorly ventilated, rodent infested buildings with little to no PPE. If you do not believe me, look up the hashtag #SafetyFirstBPS on all social media platforms. Black and brown students are overrepresented in risks of COVID-19, as well as in risk of being an afterthought when it comes to prioritizing their services as their IEP states. It is October of 2020. We must do better. Right now, what we need is high quality in-person instruction in safe spaces for those who cannot access remote learning. And we need an end to simultaneous teaching. It is not effective. We need a real plan, a plan that families, educators, students, community organizations, and managers of safe spaces have helped to create and agree is equitable. The BTU is more than willing to do their part in creating this plan. And a Chromebook is not enough. In the words of the amazing Maya Angelou, do the best you can until you know better. Then when you know better, do better. In the spring, we understood that we were all doing the best we can. Now we know better, and it is on BPS to be honest, transparent, and equitable, and do better. Thank you.
Thank you very much, Shantae. And Charlie Kim has joined us. He's just here to offer public testimony and needs to leave for the SPED PAC meeting. So I'd like to just welcome Charlie to give his comment, and then we will go to colleague questions. Thank you.
Thank you very much. Good evening, and thank you for allowing me to speak tonight. My name is Charlie Kim, and I'm here tonight on behalf of my youngest daughter, Isabella, who attends the Horace Mann School for the Deaf and Hard of Hearing. 100% of the Horace Mann students and population fall under the responsibility of BPS Special Education Office that are here today. Tonight, we are coming together to discuss mental health, social emotional support, and many other very important topics. Prior and during the pandemic, the Horace Mann School has been one of the most important supports and routines for Isabella and our family. The constant disruption and uncertainty is causing unnecessary regression and anxiety for her, along with the whole Horace Mann community. As you know, in April 2019, BPS announced that the Horace Mann building is not feasible for long-term occupation. On January 8th, 2020, Superintendent Casillas announced the Alston building will be closed in June 2021. The Horace Mann community has been staunchly advocating to BPS, school committee, Mayor Walsh, and elected officials since the announcement. I, along with a small group of Horace Mann staff, have been formally meeting in closed-door sessions with the Build BPS members, including Superintendent Casillas, CFO Nate Cooter, and Assistant Superintendent Ana Tavares. In the confidential meetings, BPS offered 3 swing space options, one of which is the Edwards building located in Charlestown. The Horace Mann formally wrote to Build BPS on September 22nd, saying we accept the Edwards building as the option. To date, a plan has not been publicly socialized. We know the 2021-2022 budget plan is due to school committee on November 18th. So what does this mean for the Horace Mann School if nothing has been socialized publicly? I would like to close with a call to action and a statement of fact. Superintendent Casillas scheduled a Zoom meeting for our community on Monday, November 2nd at 5:30. I ask all of you to join the Zoom, including elected officials, members of Boston Teachers Union, because you are part of our community, and anyone else who can help us. The statement of fact is this: a school building is just a shell. We are the school and we are the community. We will not buckle and we will not let our community fall down because BPS fails us on a building plan. Thank you very much.
Thank you, Charlie, for offering that testimony. I would like to ask if Councillor Campbell has any questions for this group, for this panel. Councillor Campbell?
Thank you. I think my son Aiden was. Aiden, you want to say hi? He kept yelling, hi. Alexander says hi. So first of all, thank you so much to the teachers. Thank you, Jessica. Thank you to the parents.
I can't see.
Okay, there's Counselor George. There's everybody. See everybody? Here, wait, they can't see you. Hold on, see?
That's such a contrast to the few times that I need to cover my mouth or yelling at my kids.
As I wear a shirt that says the future is female, and I have 2 boys. God bless. Okay, but my questions, obviously, first of all, thank you guys for the testimony and your service. I know it's not easy, and I know you've been advocating, you've been at all the hearings. What do you think are the barriers? I mean, clearly the solutions are out there as to how we serve this particular population of students. What do you think from your perspective are the barriers to getting it done? And getting past this us versus them, whether it's the media and others who want to create that framing, and not taking into consideration the fact that our infrastructure is old, our buildings, some of the buildings should not even be offered up as a possibility to use during the pandemic because they're so old. So what do you think are the solutions and how do we get there? And I also want to thank the parent, of course, for his testimony as well, which was extremely powerful and also equally sad and frustrating. So thank you.
Yep, and we will certainly join the Horace Mann community on Monday night and get that out to our members. So, I guess our biggest frustration and why we are so, I'm just going to name it, angry, is that a lot of this was avoidable. And so it really didn't have to be this difficult. We literally gave solutions which still can be implemented. We have offered to sign agreements, work over the weekends, work out at night to get this done. And it begins again with safe facilities. We said that from the start. We keep asking for the information too. So I guess that's part of the solution. It's one thing to be at a table to hear a partial plan, but it's another to be able to actually get the data to help really inform how to implement that plan. And so if we are committed to moving forward. So we'd like as soon as possible to get an agreement where, again, the facilities are verifiably safe. And again, we're not asking for 100 HVAC systems to overnight be, all of a sudden created in our school buildings. That's obviously not something realistic. But what we do think is realistic is HEPA air purifiers that are adequate for the square footage. What we do think is reasonable is on-site testing because other districts have been able to figure it out. I know that we can too. And the current testing, which is previously it was at the Red Sox facilities only between 4 and 7, where again, teachers were actually assigned a time slot even when they were still teaching, which wasn't going to work. And so that testing is definitely a solution to access to rapid testing. The PPE, it's got to be not just a week supply or 2 week supply. Even in the 7-10 days that we were back, there were already classrooms running out of PPE. And the nurses' offices didn't have all of the orders that they needed to be able to be fulfilled even on when students were coming and they didn't have everything they need for PPE. So that's certainly another one too. But again, the other piece is around the better instruction. We said from the start that if we really want to have high quality instruction for our inclusion classrooms, our ABA classrooms, all of them, that we needed to have adequate staffing, and that adequate staffing was not a teacher by themselves simultaneously trying to teach in person and remote at the same time. We had asked for flexibility and creativity in scheduling. And so right before the schools closed down, we had already met several times, and it was only supposed to be once a week. And I asked, can we please have more than one meeting a week, so that as these plans are coming in, that as quickly as possible, we're able to have the creative plans that allow for the flexibility for better instruction for our students. And so we had a couple dozen come in before the all remote was called. And those plans need to continue because our hope again is to bring as many students back in person as possible. So those are some immediate things that the district can and should implement, but they need to meet with us. So that was part of the problem, is we kept saying, can we meet? We're not going to get an agreement done if we're actually not taking the time to schedule meetings, and it cannot just be 1 hour a week. It's got to be more often than that. And so that has been our ask: meet with us. I I'm trying to be balanced to give credit where credit's due. So they did finally agree to an HIPP task force, and we said we need to have students and parents at the table. And so they agreed to that. And we did meet on Monday. And, but we said, hey, if it takes meeting every single day in the next 2 weeks, we're ready and willing to do that. But right now we have one more meeting scheduled for next Monday. But it's literally a matter of just agreeing to meet with us so that we can make progress and get these agreements done and ensure that our families and our students and educators are in safe environments so that we can get in-person services done as quickly as possible. But what pains me the most is even if BPS, which I hope they do, agrees to our proposal that we're jointly creating right now with the SPEDPAC and Beja and other stakeholders, is that it's going to take more time. And that has been the biggest frustration, is that if they'd done what we'd asked them to do months ago, then we wouldn't be in this position where we had to have interruptions in services. So I guess the short answer is meet with us, talk to us, share data with us, help us be problem solvers with you, and hear us, listen to our ideas, please. We are the ones on the ground. We are the ones who are actually executing the plans. And even, the most well-intentioned plans, if you don't talk to the people on the ground who are actually executing them, are going to have gaps and holes and not be a better plan. And that's what we're asking for, as Shantae said, a better plan. And we want to be a part of the solution, and we've always been trying to be a part of the solution.
No, I will say that's extremely helpful, and it's this is what I have. Don't ask. Halloween got here early. But that's also what I've been hearing from many teachers and educators and staff on the ground. I'm doing my best to respond to all of my emails just to acknowledge the frustration of our educators right now. So I just want you to know I hear you, took a lot of notes, and will continue to advocate and push. And it is unfortunate that it's going to take more time because we have not done the best in terms of planning and been proactive. So continuing to work in partnership with you guys. Thank you so much. And thank you, Counselor Sabi-George. I think I heard the bell ring.
Bye. Bye. On that note, bye.
But,
Counselor Wu.
Thank you guys so much.
Thank you. Counselor Wu.
Hi, Madam Chair. I was on and off, so I'm sorry I missed most of the testimony from this panel. I'll catch up, but I won't ask questions in this round because of that. Thank you.
Thank you, Counselor Wu. I do have a couple of questions. I appreciate your testimony and presentation remarks, as well as your patience tonight. Can anyone speak to the training that is provided for inclusion teachers and offer advice to what we need to do to create the right classroom environment to support students in an inclusion setting? And I know that we talked a little bit about, I get and I appreciate that one teacher with 3 licenses doesn't equal 3 people, but if someone could just talk to a little bit of length, or a few of you talk to what it means to have a thoughtful and how to create a thoughtful and appropriate inclusion classroom.
Well, one of the things that I've noticed in my experience with working with students in the inclusion setting, as well as the ABA strands, is that oftentimes there's not enough planning, pre-planning for when a student is about to enter into an inclusion classroom. So oftentimes what will happen is a student will be presented for inclusion opportunities, and the teacher herself may not know very much about that student, what their actual behavioral issues are, where their cognitive level is, where their social level is. And so there's so much that's novel to both the teacher and the student that it creates a situation that can sometimes not be tenable for either one. And so there's definitely a need for more planning, more of a cohesive kind of conversation about who is going to be entering into the classroom and what is the best condition for them to be able to do that. And also too, the teacher, like a teacher can't remotely teach and also in person teach. A teacher can't attend to a large group instruction and attend to all the behavioral needs and social needs of a child who's come into their classroom as part of the inclusion environment. So the teacher certainly needs assistance. She needs not only assistance in behavioral management, but she also needs assistance in how to best serve a child who learns differently from the entire population of her classroom. And again, that takes some cohesive, comprehensive planning. Oftentimes it takes collaboration with the speech and language pathologist to talk about the different communication needs and how the teacher is going to have to structure her room differently. It takes collaboration with the occupational therapist about how the student is not necessarily going to have the same in-seat behavior that her gen ed students have, and what that means, and how to serve that student who is going to look and perform differently. So it really requires a comprehensive, well thought out plan to address all of these different needs that a student has. I mean, oftentimes when at the Curley School, we're very fortunate. We work very collaboratively. But when teachers are thirsty for this information, it's oftentimes, I think, unfortunately, the thought is that teachers don't want these students in their classroom, and that's not it. They're thirsty. They want this information, but they want to do inclusion right. They don't want to do it haphazardly. They want this information. They're professionals. They want to do a professional job, and that requires specific steps.
If I may
Thank
go.
you very much. Yeah, absolutely.
Sorry to cut you off. Thank you, Funda, because I think you did a beautiful job of sharing all the responsibilities that a teacher, an inclusion teacher, needs to be able to handle and juggle. And so as an inclusion teacher, I can tell you, Madam Chair, that all you need to be an inclusion teacher, all you're trained per se to be an inclusion teacher is to have licensure. That is all that is required to be an inclusion teacher. It is on the teacher to seek out opportunities to get PD on best practices, whether that be in the form of pursuing another degree or professional development outside of the district. There are some PDs that are offered throughout the year, and hopefully they're offered when you're not teaching or you're able to take off from work to be able to attend those PDs. There is not a set of training that you would think a teacher who is dealing with such a beautiful but delicate population would be required to partake in order to teach those students. And prime example myself, just because I am a teacher of color and I'm teaching in an inclusion classroom with students of color does not mean that I'm effectively able to connect with those students. I am a teacher from Long Island, New York, so I don't understand what it means to grow up in Boston, Massachusetts. I had to venture into the neighborhoods. I had to be brave, as I tell my students, in going into towns that I may have heard things about, but these are where my students are coming from, and I need to understand what they are seeing on their way to school or on their way home. I need to be able to build relationships with my families to better understand the students that I'm supposed to be reaching on a holistic level, not just through a curriculum that is taught for 15 minutes a day, or not through hand bumps in the morning. Like, it's more than just the gestures I do, or it's more than the curriculum I teach. And so I had to read books. I had to attend PDs. I take courses in the summer on my own to make sure that I'm getting better at my practice, because there is no program out there that properly trains you or effectively trains you to be the best possible inclusion teacher. It can prepare you, it can give you that solid foundation, but it is a disservice to students if we end with our 4-year degree or our 2 years master's degree and think we know everything. Students are constantly evolving and constantly changing. As educators, we need to be able to attend PDs or continue our education. And there is no funding or support, or even email saying these PDs are coming up, feel free to attend them, or we would like to send 10 to 15 teachers. And to speak to someone's point earlier about Wilson training, I was denied with Wilson training, Orton Gillingham training this summer, and I desperately wanted to take that training. I don't know why I was denied. They picked a couple teachers from my school, but we're a full inclusion school. So if you ask me, every inclusion teacher should be trained in that. But I understand that there's money and funding, and that decides who gets to be trained in that. But if you're sitting here telling me that that is the best way to effectively reach a student who has learning needs that I can best support, then why isn't every teacher trained in that, or every permanent teacher trained in that? Like, we need to figure out a way to provide our teachers with proper training outside of a degree and outside of 2 or 3 MTELs, because that is not enough.
Good.
Thank you, Chantel, Shantae, I think that it is so important that that we're not just simply offering training to teachers, but creating real opportunities for them to take advantage of those trainings, especially if you've got a full inclusion school. Victoria, were you going to add to that? No, very good. Welcome back, Counselor Flynn. I did bring in just now Kelsey Brendel. I do have additional questions, but Kelsey is also a SPED PAC parent about to head out to that meeting. So I wanted to give Kelsey an opportunity to share some testimony. Then we'll go to Counselor Flynn for any questions. And then I've got a few more. Welcome,
Thank you.
Kelsey.
Thank you so much, Madam Chair. I won't take up too much time. I hope I just really wanted to frankly emphasize how much it takes for, a special education parent to take time away. And this is probably the only meeting other than, the one specific to special education that I would wait 2.5 hours, literally depending on a neighbor to be sitting by the bedside of my little boy to be at. It's that important. But I really want to emphasize just a couple of things. And they are that remote learning for these high needs kids that we keep referring to is, again, not an inconvenience. It is completely an impossibility. And I say that referring to my own little boy. Again, he's 7 years old. And one of the reasons I'm able to be on this call at all is because he's had so many seizures today. He went to bed 2 hours ago and someone is sitting next to him. And I just want to remind people kindly, please know who you're talking to and about, because these are the invisible folks that we keep talking about politically, or when races are hot, or when it's fun to write an article or a piece that talks about the unseen people. But these kids really are who you are not hearing from. And ironically, of course, because many of them, including my own son, cannot speak. So this is well worth the wait, Madam Chair, and I really appreciate the time, but I would ask everyone, please take the time to wonder, while everybody is reading and citing data and talking about best practices and conferencing and caucusing and coming up with committees and finding truly generous ways to talk about understanding frustration. This is not frustration, it is devastation. And I will say, the other elephant in the room here is that we are not only devastated, we are desperate. There's going to be an additional epidemic here of people who are truly devastated beyond what I can even describe and do not know what to do. And I am one of the lucky ones, and that's how I feel. This is not about a learning loss. It's a survival loss. It's not just about learning. This is about talking and walking and swallowing and being able to even walk to get the mail with your child. Those are the rudimentary kind of things we're talking about here. So I would beg everyone again, please, while it's a fun sort of nuanced remark to talk about gathering around the proverbial table, please wonder where we are at ours, because we can't even sit at it. We are using hospitals now and triaging every single moment. So I'll just close by saying again about the remote learning piece. It is like telling someone, who's waiting for a transplant that not only, do we not have one available, but they'll just need to walk to the hospital and check on it, while we're working on it. All while people say, well, we have a system and a plan, a pedagogy, and it's not that anyone's mad. It's that people are desperate. So I just wanted to be an added voice, hopefully not an annoyance. And I would ask you to go on your own listening and watching tours, because we really do need to be seen. Do a call, a meeting where you ask to see and look at who these kids are, because I guarantee you, when you see them in their wheelchairs, when you see them trying to pick up a crayon to write you a note, when you watch their parent run away from the Zoom call, hopefully changing a diaper in time for a 10-year-old, it takes on a very, very different tenor. So please, I beg of you all on this, and am grateful and thankful for your tremendous work and efforts. But I am asking personally, and on behalf of my little boy and so many others, for actual help When you hang up, think of one parent to actually call, call or write them. And that is connection. So when we talk about all things remote, remember that by definition, it means, that things are done from one handset, and distantly. So that's all I would say. Of course, I've talked too much, but I really appreciate the time, the effort, the sweat, the tears. And I do hope you'll think about a listening tour or something similar. So thank you so much.
Kelsey, thank you very much. I think that you didn't speak too much for sure. And I appreciate the I appreciate the opportunity to listen to you and to hear the stress and the devastation and distress that you've just shared with us. Thank you for that. Councillor Flynn, any questions for this panel? And this panel is Kafunda, Jessica, Victoria, and Shantae.
Thank you. Thank you, Councillor Asabi George. I just want to say, thank you to the parents. I always enjoy listening, and the reason I do, because it makes us a better elected official by listening to the concerns of parents, special needs parents, and then the real unsung heroes of our city, always fighting for their child, along with the teachers as well. So I just want to say to the parents and to the teachers that, we support you, but the real important way an elected official supports you is during the budget season, is making sure that we advocate effectively on your behalf for special education programs at City Hall or at the State House. So, I will continue to listen and hopefully to be a strong leader in support of special education. Thank you, Councillor Asabi George. Thank you to the panelists, and thank you to President Tang and the Teachers Union as well for their exceptional job they're doing.
Thank you, Councillor Flynn. So we are going to head over to public testimony, and as we prepare to bring public testimony folks into this part of the Zoom, I do have one question around the mental health supports. We talk a lot, and Jessica mentioned it. It was talked about in the last panel about increasing the mental health supports. I want at least one full-time provider in each one of our school buildings. But there is a lot of, I don't know if it's disagreement, but discussion around what type of provider, what is the licensed type of provider that is most appropriate? And is that a place where there's some flexibility, whether it's a school psychologist, whether it's a licensed social worker, whether it's a licensed mental health professional? Is there, what's some of the desire, the thinking, and the why?
Right. So that's a minimum that we're asking for.
Oh yeah, no, absolutely.
But it depends on the school's population and the student needs. And I guess one frustration too is that unfortunately there is inequity in the district. And one of our teacher leader fellows actually did a study, and the highest needs schools actually had the least number of social workers and counselors versus the schools that actually had more white students and more upper class or middle class students. And that's completely backwards. And so I think there absolutely is some flexibility in beyond the minimum of how many social workers and counselors. And there also are differences. We have pupil adjustment counselors who are now under the label social workers, for example. And we also do need positions, for example, like cell coaches. I think someone mentioned earlier that cell has to begin with adults. Actually, this work is very near and dear to my heart. And the very first book I purchased, actually and gifted to the superintendent, is this book called Permission to Feel. It was written by Dr. Mark Brackett. He's at the director of the Yale Child Study Center, and helped come up with CASTLE and a lot of the programs and framework that our school psychologists use with the comprehensive behavioral health model and PBIS, positive behavioral intervention systems and such. But if we don't, and he always says the problem with districts oftentimes is that you try to teach teachers how to teach cell to students without actually taking the first year to ensure that adults themselves have the cell competencies and have the skills, because if they aren't taking the time themselves, then they're not going to be able to fully apply it and implement it in the schools. And it can't be just something that's done at the beginning of the school year, but it has to be done throughout the school year. So I already heard from educators who are saying, yeah, that cell PD was great at the beginning of the year, but right now no one cares about cell because all they care about now is testing. And now it's all about testing, and then the map testing is a whole, maybe conversation for another hearing. But it's yes. So I guess to answer, that was kind of a long response, but yes, there's some flexibility, but we need minimum staffing first before we can talk about, is it that we need 3 social workers or a guidance counselor or pupil adjustment counselor versus a cell coach.
Yeah, and for me, it's about getting to that one permanent person in each building, certainly recognizing that we need more than one, and so many.
The licensure piece is really key. I think we have, the district gave a number of 107 social workers in various roles, and that is constantly what they say to us, in various roles. So if you have someone who is an administrator who has a social worker license, they are not working as a social worker in the district. They are working as an administrator. And I feel like they keep saying that to us. And what they ask us is to do more with bare bones staff. We are barely at staff before this pandemic. And now it's like, hey, we just need you to add all of that cell, and we need to do it on top of everything else. We don't only service the students of Boston Public Schools. If you are a child who is a resident of the city of Boston, we service you. If you go to private school and parochial school, it is BPS who services you. It is us. So we need more people to do right by the students, by the children of the city.
Thank you very much, Victoria, for all that. Anything else from the panels, or Councilor Flynn, another question before we get to public testimony?
No, Councilor Asabi George, I don't have any questions.
I've moved a few folks over from the participants list. Victoria, Kafunda, Shantae, and Jessica, you're welcome to stay for this or move on. But I've got my public testimony list here, so I'm gonna run down the list. I see some reunions here and some waving at each other. I love it. So I'm gonna start first for public testimony. Ms. Catherine Chu, welcome. Just state your name for the record and try to keep it to 2 minutes. Unmute yourself.
My name is, sorry about my dog. My name is Catherine Chu, and I'm the guidance director for the Boston Public School. And I am just so to see my colleagues here, Victoria, who is the school psychologist at McKinley, as well as all of the other teachers and administrators. I work as the school guidance director for the city of Boston, for the Boston Public Schools, and I work with Andrea and Carmen and Yvonne. I oversee, I coordinate the work of our school guidance counselors. And oftentimes, as we talk about numbers, our school guidance counselors, because they're hired by the school, they don't, sometimes they get forgotten, but they never get forgotten because they're so integral to the part of the school. And I think people just think about, like, they don't think about it because it's like you go, you see a counselor. So I want to just read my statement, and hopefully I won't go over my 2 minutes. School guidance counselors in Massachusetts are DESE licensed specialized student support professionals who have at minimum a master's level degree and training. We are a part of a team of mental health experts who work with students individually and collectively to create a school climate that leads to healthy learning and growing. School counselors' work today falls into 3 domains: career and college development, academic development, and social and emotional development. As an integral part of our school student support system, school guidance counselors work collaboratively with psychologists, social workers, school adjustment counselors, and nurses. We also respond to students who are facing personal challenges and steer them toward appropriate services at school or in the community. Most importantly, school guidance counselors work with all students. We deliver services through the classroom, small groups, individually, as well as whole school and whole community. The amount of time school counselors devote to each of these domains can vary depending on the composition of the student success team at that school and the composition of the school and the needs of the student and families at that school and the needs of the individual students that we serve. While most people think of school counselors in the context of academic planning and support, changing class schedules, post-secondary exploration and career planning, and applying to college and scholarships, school guidance counselors are very active and involved in the domains of personal and social development and short-term crisis interventions. We love our careers because we walk all aspects of the journey with our students and families. One class period, we may be running a career panel on how to apply for apprenticeships. Right after that, we're fielding a call from the Department of Children and Family while they're conducting an investigation on the neglect and abuse report that we may have filed. Many of the school guidance counselors at the schools have a school at the schools that have a school counselor are members of the school-based crisis response team, are well-known colleagues of the best team of emergency mental health responders. Boston Public Schools does not, unfortunately, have a minimum of at least one school counselor at each school. We want to thank the City Council for holding this hearing to ensure that each and every Boston Public School has at least one DESE certified licensed specialized instructional support professional in each BPS school building who are able to focus on the mental and social emotional learning needs of our students along with the academic and career needs. School guidance counselors serve all students proactively and are an integral part of the student support system of each school. We ask that every school in Boston have at least one school counselor to proactively serve every school. Thank you.
Thank you, Ms. Chu. Next on my list, who I've moved up is Sarah Parker. Sarah? Welcome, Sarah. And if you're on the attendees list, I have not moved you over because you're not on my list for testimony. So please raise your hand if you do want to be moved over. Welcome, Sarah.
Thank you. Thank you for having me. I want to say thank you to Juan for putting me on the docket, and also thank you to all the city councilors. I'm here. My name is Sarah Parker. I am a BPS parent. I have 3 kids that go to the Linden School in West Roxbury. I have a 5th grade son, a daughter who's in 2nd grade, and a daughter who is in K2. And I'm here tonight to make a couple of points. I just want to say enough is enough, and I'm here to strongly urge the city council to put pressure where pressure is due and to call out or upon the mayor, however you want to see it or however you want to call it, because we know he holds the cards, to stop playing politics with the BTU. And we can't continue to play the union labor game to the detriment of our kids in really the future. I think the bottom line is Boston has the money and the resources to make this happen. I mean, per capita, Boston is one of the richest cities in America. Getting the kids back to school needs to be a priority. You know, I'm close to the budget process within BPS because I've done a lot of work at my own school and I understand how it works. And I don't blame the BTU and I don't blame teachers. I mean, BPS, everybody knows it's systematically underfunded. And you know, the teachers don't feel safe to go back to school, but we need to urge the mayor to make sure that he's doing what he needs to do to make sure that the teachers feel safe. Today, I listened to his press conference. It was 30 minutes. This is the mayor, Mayor Walsh. Within that 30 minutes, 5 minutes, he spoke about Boston Public Schools. He said, number one, attendance remains strong, which is not very true at all. People were talking earlier today. Roxy was saying that many kids can't even participate in remote learning. My kids go to a school with a highly involved parent base. There are kids that are not participating in remote learning. He said, 2, reopening needs to be paused until the numbers go down. And I agree, but what is the plan for the spring? And again, I'm gonna quote what Roxy Harvey said. She said, we don't need a task force for a plan. We actually need a plan. That's what she said in the beginning. You know, it's been March 2019 since the kids have been in school, and a year is gonna be quickly upon us. One other thing I wanted to touch on was the testing. You know, he talked about this in his press conference. He said, you know, the numbers are going up, but if the testing is going down, why are the numbers going up? You know, he's talking about Nubian Square, his mobile testing sites in East Boston, but we need more of these. And then this is really the point that I wanted to hone in on the most is he talked about a testing pledge. and he was touting it, and he was talking about companies that he has done this testing pledge with: Red Sox, Wayfair, Stop and Shop, Local 26. He covered the gamut of all these companies in Boston, but I didn't hear him talk about BPS. He also said city employees will be being paid to get tested. I'm wondering, are the teachers being paid to get tested? Are subs being brought in so teachers can get tested? I want to know that. And here it is. This is the other thing that one of the reporters specifically mentioned to him and asked the question about how Tufts is partnering with Medford and Somerville schools to do testing. And he said that he read about that just before the press conference. So to me, that just shows where the priority is. He's doing all these things with all these other companies for testing, but there's no priority to test BPS teachers and students. And a couple of the things that he said, and I quote, this is the mayor said this today in his press conference, he's encouraging everyone to take care of their mental health. He is encouraging everyone to look out for seniors who have loss and loneliness. And he says, quote unquote, we need to take care of our most vulnerable. So my question is why are the children not being seen as the most vulnerable? And all the talk that's happened here tonight, I mean, we see that these, especially kids with their high needs and high risk, are the most vulnerable. So I would just really urge the city councilors to put pressure on the mayor to get this done, because it needs to be done, and kids need to get back to school. And obviously the numbers are getting higher. Maybe they're not going to be going back to school in the next few weeks, but what is the plan to get these kids back to school in the spring? There is no plan. Like Roxy said, we don't need a task force for a plan with actually no plan. And that's all I really have to say. And I just really, really think that, we need to do what we can do to get the kids back to school, because it's more important. And I really view that the kids are our most vulnerable population.
Thank you very much, Sarah. Thank you for being here with us. Fabienne, I moved you up to testify, but I'm wondering if you are testifying. Fabienne?
Yes, I'm here. Hi. Thank you, and thank you for putting this event together. I mean, this hearing together. It's so well needed. I just want to echo everybody what they said before, and especially most needed for the children with learning disability. Just to rephrase on that, I believe someone, Shantae probably mentioned, or someone else mentioned about the support for the teachers. A lot of the teachers, they're willing to do the work. They want to do the work. They love the kids. But if they don't have the support from the administration, from the district, there's no way, no how they'll be able to just to do so. I'm looking at the way that parents has to spend money to look for advocates or to look for teachers, for lawyers, in order for them to have a decent IEP so they can be able to have that. And when they do have it, they have the plan of the IEP. Now the school cannot even provide the services to them, especially at this time right now. So as a parent who has a child with dyslexia, ADHD, which also social emotional support on that, what I'm hearing is just not just my child who's suffering, but so many other kids who's going through the same issues that they're having. We need that, just only the social emotional support and the school psychologists. We also need to have those people that certified, also representing who looks like them. More often, a lot of the kids, they get the social emotional support, but they shut down because they don't feel connected to the people that's serving them. And that's something that we want to make sure that, the equity is of course, not just on the social emotional, as well the teachers that providing the services on that, but also helping them to make sure that they feel welcome. During this pandemic, we have middle school and high school who's going through so much high risk, in a way, like, thinking about so many different things. I even have my kid who's now, I have to really watch her because we have to increase her medication because of so many different things that she's going through. And some of the parents who are autistic and so on, parents are screaming. You heard, like, Chelsea earlier, crying. All the time that I'm hearing parents are crying, even myself, sometimes I have to call other parents. I can't do it anymore. I'm tired. If I'm tired, other parents are tired. Who's watching over us, especially in this time during pandemic? So I am urging, if the councils, the mayor, and everybody else on this call, how they can urge to just put a plan together so parents can be able to say, okay, they're looking something forward for the spring. Because at this time right now, we don't have a plan to see how we're gonna get those kids back. We don't have a plan. Does the teachers are equipped, or they have the support they need when the kids go back? Do they have a plan to have a social emotional that the council is asking for every single school? We have 125 schools in the district, about 56 that has a full-time. What happened to the rest of it? Even though you have one full-time, you have over 600, 300 students, that person cannot be able to do it. And I've been advocate, it's not just kids who has an IEP should be able to have a social emotional. It's every single student. Because on this time right now, this is not the time to say, okay, who has ADHD, who has a social emotional support, who needs it? It's not about you picking. Everybody should be able to have some kind of a support, especially on the racial equity that we have, the housing situation that we have. We don't know what the parents are coming from. Homeless and insecurity, that's another issues that we have to look for. So I really want to urge, what is the plan that we are looking for? What other ways that we can be able to just come in? We don't want to have all this meeting, but we need action. That's what parents are looking for. And I want to say thank you to everyone in this call.
Thank you, Fabienne. And anyone else in the attendee list, please raise your blue hand if you would like to testify. Otherwise, we are going to go to our videos. We've got 3 video testimonies that are queued up. So Carrie, we can feed those in and then we'll wrap up our meeting.
Good evening. My name is Allie Bledsoe, and I'm a paraprofessional at the Henry Higginson Inclusion School in Roxbury. Previously, I worked at the Henderson School in Dorchester, and my 4 grown children are graduates of the Boston Public Schools. I'm here to talk to you about the ongoing inequity in the inclusion programs in the Boston Public Schools. Last week, Ibrahim Kendi spoke to the school committee, and he said, "The children who have the least in their homes often have the least in their schools, an ongoing crime that you have the ability to change." In my 20+ years in the Boston Public Schools, I've seen the same inequities in our inclusion programs. Black and brown children, and particularly boys, are more than twice as likely to be in sub-separate classrooms. The recent uptick in ABA strands is an example of this. At our school, we've been given an ABA program that we didn't ask for. We're an inclusion school. I've been in IEP meetings where parents of Black children are told that their children won't thrive in inclusion settings, and that even if they did, they have no chance of going to better resourced schools. At the same time, I see parents who are more affluent hiring lawyers and advocates to get their children into the schools that they want. These are often schools with a 2-teacher model instead of a teacher-para model, which is the model in the school that I work in. Please take this time during the pandemic to look at the resources in our inclusion classrooms. Don't do what we've done during COVID, which is assume that we'll deal with this later. Our inclusion programs need to be the best they can be for every child in the city of Boston, not just for children whose parents have the means to demand it. Thank you.
I think we have another video coming. 2 more.
My name is Ernzi Noel, and I am a teacher for Boston Public Schools. I just want to begin by saying thank you to those here tonight, and thank you to those making it possible for us to even have this conversation. Inclusion students are some of our most vulnerable students, and we need to work together to ensure that we do this right for them. Educators who teach in person will be teaching only in-person students and not remotely at the same time. A standard I think we should all agree upon, especially when thinking about our 1 teacher and 1 para inclusion classrooms. We are all working hard and trying to figure out remote teaching. We are building systems and routines that work for our students. We are building relationships with families in ways that are amazing. Collaboration is key to the success of this situation, and teachers and families are working hard to make this happen. But as we try to lift each other up, there are structural and systematic supports that need to be in place to make this happen. I am here recording this video tonight to express growing concerns I have about inclusion and it being done right. Right now, I am a K-2 inclusion teacher. I have a great relationship with my students, and I am working hard to meet the needs of my families. Today, on top of teaching live on Zoom, I was in school completing a special education assessment on a student. Both he and his family was present. We started at 8:45 a.m., but not before I had to log on to Zoom, assign my para as a co-host, and say good morning to my class. We plan to finish at 9:30. But of course, as much as we planned, things happened, and this student needed to move on to the next assessor. There were a series of teachers and service providers in the building today that needed to test him as well. Both he and I had a very long day. I needed to get back to teaching math. The transition from assessing to teaching was not as smooth as my para and I hoped for. We needed to work out a few kinks on Zoom and a few scheduling kinks. Again, this was all live. We resumed our normal teaching, but I had to step out again at 12:30 to 1:30 to finish up testing, leaving my para alone to navigate Zoom, breakout rooms, service providers popping in and out to meet with other students, teaching and introducing centers on Seesaw, as well as troubleshooting technical things on Zoom and Seesaw with the families and students that needed it. What today reminded me so clearly is that inclusion done right is not one teacher and 2 licenses and a para. We need more supports in our classroom to ensure the success of our students. 1 teacher, 2 licenses, and 1 para is not enough. I hope that this message is clear. I hope that what I'm asking for and what our students need is clear. Again, thank you to those here tonight and to those hearing this message. Please continue to support us as we work hard to teach the students of Boston.
We have one more video.
Hi, my name is Mark Knapp, and this is my 21st year teaching at Josiah Quincy Upper School. I'm speaking in support of inclusion done right. The needs of these students were not being met before the pandemic, and they certainly aren't now when we have in-person teaching for a teacher that now also needs to split their time virtually teaching the students that aren't coming in person. That's not a solution. Number 2, air quality. In order for students and teachers to feel safe in-person teaching, we need to make sure that air quality is safe. At our 2 building sites we've known for a long time, those areas have the highest air pollution in the city of Boston. So asking us to open up windows and turn on fans to blow in fresh air is also not a solution. We need classroom air purifiers that move enough air and move enough clean air using M13 filters that ensures that everybody in that classroom is safe. These are challenging times, but I know that Boston Public Schools can do better. Thank you very much.
Thank you very much, Carrie, for setting those up for us. And thank you to everyone who offered testimony, and for the panelists, both the administration and our school educators and the president of the Boston Teachers Union, Jessica Tang, as well as our 2 parents, Roxy and Edith, who started us off this afternoon. I do appreciate everyone's time. I appreciate my colleagues who are still with us and co-sponsor of the dyslexia hearing, Counselor Flynn, for joining us. Counselor, I don't know if you have any closing remarks, or shall we just simply say goodnight, Counselor Flynn?
Yeah, thank you, Counselor Sabi George. I just want to say thank you for your leadership on this important issue and other important education issues. I want to say thank you to the panelists, the Jessica and the Teachers Union, and Boston's about working together, especially during difficult times. It's about giving people a helping hand, especially when you need it most. So I just want to say thank you to the panelists for providing excellent feedback and information that will make us a better city and hopefully provide the services that your child needs.
Thank you, Mr. Flynn. I think, I've said this a few times during today's hearing that, we took this group of topics and hearing orders together as a batch. Most of these were filed pre-COVID, and I think 2 were filed pre-COVID and one or 2 in the midst of COVID. I forget what the breakdown is. They're certainly very important to discuss, thinking about the impacts of COVID on our families and on our school system. But they're also really important to talk about how do they look in, more normal situation. When I think about how inclusion done right should look like, both remotely, hybrid, and then when we do return to whatever that new normal looks like. So my recommendation, and as chair, what I think I'll do next is lead maybe some smaller working group sessions, breaking down those 4 different subject areas. But I think recognizing that mental health certainly touches all of those areas at the same time. And mental health right now is perhaps the most significant component of what we need to be doing for our students and their families today. So a lot more work to come, a lot more conversation to come, and in this series around our education hearings, especially around reopening our schools. In a couple of weeks, we've got planned a hearing specific to the facilities currently, and I think we'll probably have a little conversation. A part of that conversation will include facilities going forward, because we do have Build BPS underway. And I think some of you I'll see at that Monday meeting.
Counselor Sabi George?
Yes.
Hey, I just wanted to thank you guys.
You're welcome. Sorry about that.
No, it's Counselor Campbell. I just wanted to thank you guys. I intentionally waited to listen to the public testimony, and it was painful at moments. But thank you and Counselor Flynn for creating this space. It was critically important, particularly in this moment in time, to have this conversation with respect to our special needs students and what we have to do. So thank you. And again, thank you to all the parents who stayed on to testify. And of course, looking forward to getting action done and working in partnership with you. So thank you guys.
Thank you about that. Sorry, I missed you. You moved on my screen. All right, very good, everybody.
No problem. Thank you.
We'll see everybody soon, I'm sure. Have a good night. Be good.
Good night, you guys.
Good night.
Good night. Carrie, thank you so much. And Juan, thank you. And whoever else is back there in the magic box. Goodbye. Good night.